FM, Hagaya, Guam. You're listening to The Link with Chris and Sabrina on Breeze 93.9.
You got that fire, fire. You speak to me, you know our words flow free so naturally. And I'm feeling fine cause these eyes can see this vibe brings pure positivity. You know, you take mine every breath you take. I'm loving every stride, every step you make. They say you be breaking ice when you pass by. And I know why, yeah I know why. Got that fire, fire, girl you take me higher. And I don't wanna come back down. Fire, fire, girl, you take me higher, and I don't wanna come back down. Oh, na na, fire, fire, girl, you take me higher, and I don't wanna come back down. You got that fire, fire, girl, you take me higher, and I don't wanna come back down. To those eyes, you know you got me in entrance, you got me hypnotized. And I won't sleep till I get that prize. So plenteous, girl, I know I must devise. In the nighttime I lie awake, contemplating about the next big step to take. You know, maybe this could be something great. Or baby, maybe I can just be your next worst mistake. Got that fire, fire, girl, you take me higher. And I don't wanna come back down. Fire, fire, girl, you take me higher, and I don't wanna come back down. Oh, na na, fire, fire, girl, you take me higher, and I don't wanna come back down. You got that fire, fire, girl, you take me higher, and I don't wanna come back down. Fire, girl, you take me higher, and I don't wanna come back down. You got that fire, fire, girl, you take me higher, and I don't wanna come back down. Oh, na na, fire, fire, girl, you take me higher, and I don't wanna come back down. You got that fire, fire, girl, you take me higher, and I don't wanna come back down.
The Link. Join the conversation now with Chris and Sabrina. Call 637-0094. Breeze 93.9 FM.
lost somewhere in the wilderness. But it's okay, I gotta let this beast inside out some days. And in this jungle, the concrete and booze and broken hearts and getting used. Oh, I'm feeling pretty found out today. These complications I gotta do complicated. And my frustrations are got me too frustrated. That fire inside me keeps going, the water around me keeps flowing. And I'm thinking I'm gonna be fine today. Never stop when I'm singing the blues. Oh, my heart, it just needs to speak some days. And in this sea of useless hearts and battered dreams, oh, I'm feeling like getting out today. These complications I gotta do complicated. And my frustrations I got me too frustrated. That fire inside me keeps going, the water around me keeps flowing. And I'm thinking I'm gonna be fine today. Yeah, sometimes in the morning, well, I wake up and I tell myself I wish I could have opened my eyes and just be somewhere else. But I'm ways to love and new places to be, new people to speak with and a new faces to see. Because every day is just the same old thing, yeah. They know what I've been through and they know what I'm saying. It's just the thought and the principle of being invincible and highly unpredictable and practically invincible. It's got me smiling just a bit and my vision shifts. And I know even though these complications I gotta do complicated, and my frustrations are gonna be too frustrated. That fire inside me keeps going, the water around me keeps flowing. And I'm thinking I'm gonna be fine today. I'm gonna be fine, fine, I'm gonna be fine, fine, I'm gonna be fine, fine, I'm gonna be fine today. I'm gonna be fine, fine, I'm gonna be fine, fine, I'm gonna be fine, fine, I'm gonna be fine today.
Link up with Chris and Sabrina at 637-0094 on Breeze 93.9 FM.
Wondered if you ever felt guilty about leaving me, my sisters, and not showing us some feeling. Living without my daddy, I thought it'll make me stronger, but it really made me weaker. I can't deal with it no longer. You may have paid for child support, but money never occurred to me. All I ever wanted was my daddy right here next to me. Sometimes I grip my teeth and tell myself that I hate you. Even God knows that's a lie. I just really, really miss you. Even though you let me down, you always came right back around, showing me that you care, but always leaving me with doubt. Time and time you try, but at times you seem to quit. And I know that in your heart there's so much that you regret. I know you feel us missing you, flowing through you like water. Know you looking down, smiling on your son and on your daughter. Even though it gets harder, knowing that you're not here no more, I just wanna let you know, I wish you got to know.
I'm missing you, and it seems like every day I start crying. I just hope
the tears will all just go away. And I wish I got to say everything I had to say. My words forever stay. But I know you live on, know you live on, know you live on. But it's what it's got to be, but your memories will stay with me, with me. I hated going to school and having everybody laugh at me, cause I couldn't catch a ball, had no daddy to play catch with me. I hit an honor roll all throughout elementary, got the good grades, but my dad never came back to me. I did so good, don't know why he didn't want me. That's why everything I do it for my mommy. My mama raised a fine man, I know that you'll be proud, and to know that your son will be graduating now. Before you died, you promised you'll be at my graduation, and I know that you'll be watching me without no hesitation. And every situation are gonna have its complications, and it seems like you not being here is my biggest frustration. I just wanted to know it, that father-son moment. At times I wanna cry, but I'm just afraid to show it. But I guess I might have to suck it up and be a man, cause it seems the only way that I can. I'm missing you, and it seems like every day I'll start crying. I just hope the tears will all just go away. And I wish I got to say everything I had to say. My words forever stay. But I know you live on, know you live on, know you live on. But it's what it's got to be, but your memories will stay with me, with me. Remember when I came and I offered you a ticket, and you promised me and swore to God you wouldn't miss it, but you did and you never showed. That was cold, but who knew that you would make it for it somewhere down the road? You came to my confirmation, I was so glad that you made it. Remember walking, praying, and thanking Lord for that day. And even though you didn't say much, I was so happy to see you. Even if it was for a minute, I just finally believed you. You told us you loved us, even though you above us. I can still hear your heart beating, pounding hard like thunder. You made your love known, showed it to the world. Finally, my sisters all felt like daddy's little girls. I became a man, I know you're gone, so I'm trying to take care of all the girls the best way that I can. And, I know you died, but homie, still you tried, and all I can do is cry. I'm missing you, and it seems like every day I'll start crying. I just hope the tears will all just go away. And I wish I got to say everything I had to say. My words forever stay. But I know you live on, know you live on, know you live on. But it's what it's got to be, but your memories will stay with me, with me.
Così uli di sombranzeltemak e zu te saluda antes di niga Radzaudzan malak estrezas durante in todo in memu a no distancia como kupugi palu zaniman malak guafi ikonum nasugi airi prebatu la noci nai banderata gaigi pues atan fanni bandera kau esta pagua pumalapa giluk tanu man libri sentami ti man ko
Fanogi chamoru politanota kantai matunonya gitoru iluga Paraiona Parai Gloria a big islas empire Paraiona Parai Gloria a big islas empire Toru I tempo I pas Paraita Zangin langit na bendition Contra biligo na fansofuam Jus bruteis langom Contra biligo na
you should've listened. You're my man. You got what I need. Calling to come running up on what is it you're seeking. Don't worry, boy, don't worry about a thing. You can put your trust in me. Just say the word, what it is that got you bugging. I'll be there whenever you are stressing. And when I do get close to you, all of your friends ain't got no clue. I just can't wait to be with you. I promise I'll make everything so easy. Boy, I'll be faithful. Promise not to hurt your heart. Swear I'm not able. I loved you from the very start. My love's on the table. Take it how you want it, boy. Yeah. Take it how you want it. Boy, I'll be faithful. I promise not to hurt your heart. Swear I'm not able. I loved you from the very start. My love's on the table. Take it how you want it, boy. Yeah. Take it how you want it, boy. Boy, I'm all yours. Do it how you wanna. Put me on your shoulders. Got me a soldier. Here's the plan. Stay forever in my heart. Always by your side. Till death do us apart. Don't worry, boy. Don't worry about a thing. You can put your trust in me. Say the word, what it is that got you bugging. I'll be there whenever you are stressing. And when I do, close to you, all of your friends ain't got no clue. I just can't wait to be with you. I promise I'll make everything so easy. Boy, I'll be faithful. Promise not to hurt your heart. Swear I'm not able. I loved you from the very start. My love's on the table. Take it how you want it, boy. Yeah. Take it how you want it. Boy, I'll be faithful. I promise not to hurt your heart. Swear I'm not able. I loved you from the very start. My love's on the table. Take it how you want it, boy. Yeah. Take it how you want it, boy. Take it how you want it. How you like it. When you need it. Yeah. Take it how you want it. How you like it. When you need it. Take it how you want it. How you like it. When you need it. Take it how you want it. How you like it. When you need it. Take it how you want it. How you like it. When you need it. Oh. Take it how you want it. How you want it. Take it how you want it.
Good morning, Guam. Huh. Good morning. Good morning. It's a bipolar morning, right? Rain. It was raining hard earlier. Now it's a little bit sunny. It's Wednesday, hump day. My name's Chris.
I'm Jason. That's Joser, who got a gorgeous shot of those sunbeams just
Beautiful.
coming out.
Sunbeams coming out. Thank you, Joe, sir.
That was
Always
wonderful.
getting creative with the link cam. It's Wednesday, May 5th.
We've said this before. We'll say it a million times. It is impossible. I don't care what kind of camera you have, how old, how beat up, and you can take a beautiful picture of a sunrise or sunset on Guam with any gear.
That's right. Beautiful. Work of art. Sometimes, you know what, guys? You don't always have to take a picture. Take a picture with your mind.
Store that image in the flash drive of your heart.
Yeah. All right. Is that what I sounded like? Take a picture with your mind. Do it the old-fashioned way.
You've been swinging for the fences this week with like your analogies. And
Yeah,
your sayings
you know. I got to go big because Bree's coming back. By the way, welcome back to Sabrina Salas Mantanani.
She has made landfall, everybody. Yes,
Yeah.
your Link princess is on the island, and we thank each and every one of you for always wishing her well.
Guess where she's at, though, guys? Guess. Yep. She's not a doctor coming from India. Nope. She's just little old Sabrina Salas Mantonani.
She's at the QFAC.
She's in the quarantine facility. Yep.
And you know what? You know who else is there? Nestor Lecanto.
Oh, what? Oh, dude, we got to do our whole news from the quarantine.
Yeah, I mean, so basically yesterday, Nestor messaged
By the
me.
way, guys, I just got to say that for the record, according to the list of essential workers, media is supposed to be essential. Yeah, because we're informing the public. No, I'm not even trying to toot our own horn here. I'm just saying it is what it is. The black and white of it, media is essential. Because we're going to... Remember way back when the governor said when we were all locked down? Remember that? First of all, remember that? We're all locked down and there were roadblocks. Oh, I'm sorry. Not roadblocks. Checkpoints. You remember the whole roadblock checkpoint?
Oh, you got talking on Facebook
Yeah.
Live about that. I remember
Right,
you.
yeah.
It's like, okay, for our next question, we'll go to KUM, Chris Barnett, half a day governor. With these roadblocks, they're not a roadblock.
They're not a roadblock. They're not a blocking of the road. They're not a toll booth. They're not an infringement on the constitutional rights. They're a checkpoint. Yeah, I'm sorry. So remember back when they had checkpoints? And the governor said that in order to leave your house, you would need a certain letter. Like if you were going to go to the grocery store, you would need to put a G on your car or whatever. You know what I mean? We were going to get our letters for media because we were essential.
No, we had PDFs that
Yeah.
each of us had to print out and keep in our center consoles or glove compartments.
It's right there with the CDC. Anyway, but I'm just saying it is what it is. We're not saying, oh, we don't need to go to quarantine because we are media. In fact, I'm sure Sabrina and Nestor know that they're classified as essential, but you think Bree's still sleeping?
She's probably watching. No, with you
Okay,
know,
because-
traveling from Vegas.
Because
to
let
here-
me just tell you how Bree is, guys. Bree is the kind of person, and I told her yesterday, she called me from Japan. I was like, man, there's still time for you to get in your paperwork because you're essential. And she was like, yeah, but I don't want to go and be essential, and then I'm going to come on the link, and people are going to be like, oh, you didn't even go to quarantine. That's the kind of person Bree is.
Yeah.
She doesn't want to receive any favors or gifts. You know,
Or
she
be
doesn't.
that person.
Yeah. She doesn't want to, get your building for 2 weeks for free of charge. No, she doesn't. She's like, if I got to go in, I got to go in. I was like, okay.
You lead by example.
But then she was like, make sure they bring my laptop so I could Zoom for
Yeah.
the quarantine.
Okay, well, I've got a sub story for that. So Nestor messaged me yesterday, and he's like, "Hey, Jace, have you got time at 1 o'clock? Can we record Janella real quick, right?" And I was like, "Yeah, no problem." So Janella Carrera, our good friend from Public Health, the PIO, and she gave us a few minutes. And so Janella came in the Zoom room first, right? I was setting everything up, doing all the tech stuff. So Janella's there, so I said hi to her and everything. And then Nestor came in about 30 seconds later. As soon as he came on screen, big smile on Janella's face, and she goes, "Nestor, you're in the quarantine facility." And then she was like, "Wait a minute, why are you in the quarantine facility?" And he was like, "Oh, I was in Manila for the last 5 months. It was supposed to be 3, but then things got a little hairy in the Philippines." And she was like so pleased, like to see. She immediately saw, like the background, and you figure, Public
Yeah,
Health knows
yeah.
every square inch of
They
Medusa
know.
by now. But even Nestor was saying he goes the guardsmen and everybody working there have been like, the utmost professionals. He
Yeah,
goes,
yeah,
the
yeah.
food has been amazing.
Yep. Yeah.
I even asked him. I was like, "Hey, Nestor, Bree's gonna be there too. So if you want, you want a magazine, you want me to run up some, you need some snacks, some fruit, you want some beer."
Beer.
I even asked Janelle. I was like, can we?
You can bring beer because I dropped something one time to my mom and there was a dude in front of me and like all he had was a 6-pack. Like that was all he had. Actually, he had a 6-pack and a lighter. So yeah, I think you can drop beer in there.
Yeah.
629. So yeah, that's what's going on. Sabrina.
So basically, a fourth of our news team is in quarantine right now at the news.
Yeah. And Sabrina's fully vaccinated, by the way. But I'm not, she didn't want to make a big deal. I'm not even making a big deal out of it. I'm just saying it is what it is. And I just also was thinking how, and Nestor coming from the PI, we had the 2 UK variants that came in from the PI. So maybe, it's a good thing that he's in the quarantine. I mean, just in case. Yeah, that's the whole system, what it's for.
Oh, yeah, that's right. From the PI, yeah.
But I was coming on the road the other night, and I saw the buses coming in, and all I could think about was the attorneys who came on the other day and how they were saying, oh, man, people don't know their rights. And I was like, oh, man, there's 3 buses of people who don't watch the link. Because I told Sabrina, I was like, dude, assert your rights. She's like, what do you mean? I was like, I don't know. I had these lawyers on, and they're like, oh, people don't know their rights. You have to assert your rights. So I was like, why don't you make, like, I am fully vaccinated, and according to the CDC guidance, I don't need to be. She was like, yeah, I'm not going to do that.
Well, remember, like, it was about a year ago. I believe it was May when, like a friend of ours, a former KUM video guy, Dave Sablon, actually was like, one of the first cohorts of people who were quarantined. And, he was calling us every day, giving us things.
Yeah.
He said that, they treated him really, really well.
And man, the
3
guard,
squares a day.
they do it.
But the whole thing about the bus, he said that blew him away. And he was like, wait, what's happening?
Because back then, it was like internment camp or something. When people came from the airport, a lot of them didn't even, and I don't know how they didn't know we had a whole quarantine, but that's what you would hear. People come in and they'd be like, oh, what? Where am I going? Why do I have to go? And they were unhappy. And, my mom was in quarantine. She said the same thing. She said people were complaining too, of course. But when you get in there and you're stuck there, the guard and the public health people, from what I hear, because I know a few people have gone in, they're very accommodating. They're doing the best they can do under the circumstances. Right? Because they're not the ones who are throwing you guys in there. It's the governor. So, yeah. So that's what that is. And someone's going to drop Bree her laptop. And then, guys, don't tell her how crazy we went when she was gone. Because, she's the big boss.
Don't narc on us.
Yeah. Okay.
And as beautiful a shot as Joe Sir got of that wonderful sunrise and everything like that, imagine the view that Nestor and Sabrina have. I mean, I believe everybody who's been in quarantine has, like it's looking out towards the bay.
Yeah, I know.
It's at the
If you're in quarantine, you got to do the obligatory sunset from quarantine Instagram post. You have to. You have to. But I want to go back to what I was saying about how the delaying of the reopening of the island. I mean, TBH, it's seeming like a good call now, right? Right, sir? Yep. But Uno Go delivers wine and toiletries, by the way, to the QFAC.
Well, there you go.
Want to get you a nice bottle of Chianti?
Maybe some nice fava beans.
Yeah, you need some wipes in there. They got no wipes in the quarantine, guys. So call your Uno Go. There's some wipes.
Okay, yeah, but if you plan on like acting like Dr. Hannibal Lecter and everything like that, you got way bigger problems than just being in quarantine.
Oh, man. So what I was saying was...
Hey, that is a really good option, though. So if people come here and, we're lucky because, we treat our employees as family members, and like first thing I messaged Nestor last night, I was like, hey, man, I was dead ass serious last night. If you need some beer, you want some magazines, you want something to snack on, some peanuts or anything like that, I'd be more than happy because you and Bree are there. And I'm assuming because Bree in there, I'm going to have to make a run anyway because she's probably going to be like, I want some fruit roll-ups. Do they even make fruit roll-ups anymore? Well, yeah, something like that. But I'm gonna do that.
She's gonna be like, I want my boba popsicle.
Yeah, or the Melonas. Those are good. Yeah. So I told Nestor, I was like, hey, anything you want, I'm more than happy to like run something over there. They're fortunate because they've got us as a support system. If you're here for whatever reason and you don't have that, you've got Uno Go.
Right.
Check it out.
And just so you guys know, it's the standard like hotel shampoo type setup there. So, if you're one of those people who needs your conditioner, right? Like my son Chase, use Uno Go. Okay, at 6:33. But I want to go back to what I was saying about how, right, like now with these. By the way, our condolences, rest in peace of the 137th COVID-19 related fatality. But with that news and then also the 15 positives last night and kind of like we've been getting some positives, it is looking like a good call that the governor delayed the reopening of the island. Mm-hmm. But, that being said, with the quarantine policy, at least for the fully vaccinated returning residents, I wonder if there was some way that they could have looked at that individually, maybe on a piecemeal, right? Because it's just a blanket throw cold water on the whole reopening and the quarantine talk. Because, I get the whole public health side of it. I totally do. Guys, we were saying stay home. But with all these people coming back, and they're coming back because they anticipated that there wouldn't be a quarantine requirement for returning residents because of what we were told about the May 1st pat the half deadline. So I don't know. Could it have been done differently? And I understand again that we're moving with safety or moving with caution, and that's why they just kind of like shut everything down. At least any forward movement with policy change for the next 2 weeks. But at the same time, I feel like, man, our residents have really had their hopes up, And it is COVID, and you can't plan around COVID. I get it, and I hate that I have to try and like unexplain what I'm trying to say because I do get it, right? But at the same time, it just doesn't seem right that we're putting fully vaccinated residents in a quarantine facility, I mean, but hey, safety first. And it's also interesting because I'm sitting here saying it, but Sabrina and Nestor are like, no, we'll go in if that's what we got to do. So 6:35. Good morning to our Facebook Live viewers. Yeah, Tessa Mae Wilson has an interesting comment here that I think a lot of people kind of maybe might resonate with. And good morning to our Facebook Live audience here. She writes in, why set goals if nothing changes when we meet those goals? Give incentive for the vaccine.
There is a heck of an idea, and you even mentioned that.
That's exactly what we're talking about.
Yeah, you were like, hey, how about okay, not the stimmy, but what if you go get vaccinated and you get a little bit of a bonus?
Right. Yeah.
I think there is no better way to get people to really get and then now you would have 66,000 people who would say, hey, where's my $5?
Yeah. And then here's the flip side of it from Rosemary LaGuardia. Those 2 doctors were fully vaccinated and turned positive. Wait till we reach 100% herd immunity before reopening. Yeah. And then again, the reopening to me, it was kind of just like ceremonial because everybody says that, in the event we do reopen, nobody's going to come. Yeah, because our source markets or whatever are still having a hard time with COVID.
And Rosemary, she beautifully really encapsulates what the whole big conflict for over the last year has been here on the island. It's the healthcare needs and concerns against
the economic
argument. Needs and concerns and everything. And you would say that probably healthcare trumps all.
Right.
And that's totally fair. But there is a large business community that is growing ever antsy of.
Yeah. But Jay, man, honest, these people are making so much money right now. They are. The businesses they're doing really good. Could they be doing better? Well, yeah, we could all be doing better. But it's a pandemic. And I think it's kind of a wash because when we were locked down and under the stay-home orders, that was like kind of what we knew at the time. And remember when we hit that surge, things were still open. And so it's kind of been a tale of 2 islands, right? Is that we had the full-on lockdown when the numbers weren't as crazy as they were when we had the big surge.
Well, if I can dovetail with that, we have an episode of In Full Zoom, speaking of Nestor Lecanto, coming up tonight. I mean, it's been on YouTube. It's already got a ton of views and some really interesting comments. And he interviews Richard Hawes, who is a British gentleman here who owns and operates. I mean, and speaking of dichotomy, he's in a really unique position because he runs most of the luxury retail shops on the Tumon Strip. So like a lot of the ones at the plaza. So like your Chloe's, your Balenciagas, your like those ones over there, and then down at the Join Us.
How about Louis Vuitton?
Louis.
Go on, Jay.
Yeah.
Go on.
Yeah. So Louis Vuitton, Yves Saint Laurent, like those companies are. So he runs a lot of that, and he has been impacted in a massively negative way, right? Like he, had to let people go, had to like shut things down, had to cancel. I think he said like something like $3 million worth of inventory for the next year. But then he also, on the flip side of it, he also owns and manages a couple restaurants and Island Girl Coffee.
That guy.
And he even said, he goes, I think their business increased by a factor of 3 over the last year.
Yeah, no, that's what I'm saying.
So it's I mean, you guys want to watch this interview tonight because, I mean, it's somebody who has a lot of optimism about how we can return to a point of prosperity on Guam. But he also says, like he goes, I'm existing, on both sides right now. Like I've seen massive losses and I've seen pretty substantial
that's the thing, man,
gains.
is when I say like, the people are making money out here. Yeah, they're making money, but are they making enough money to cancel out everything that happened over the last 13, 14 months? And I mean, to be fair, there's been a lot of federal aid that has come down from whether it's the SBA or, you know, the stimuluses or the PUAs or the PPP or the EIDL. So, and I mean, that's always the question, right? Like, they're doing good now, but is it going to be able to wash out all the losses from the last year that weren't mitigated by all this aid?
You know, when I was going over the numbers last night after because the announcement came out about the 137th COVID-related fatality
Right, yeah.
right before we went on and did the news last night, so just shortly before 6, and I was kind of looking at some of the stats and the data, as I'm wont to do, and the things that Dr. Felix Cabrera was talking about in the last press conference about the metrics that they really use.
Yeah.
He said some of the key ones are: is the number of hospitalized people 10? Right now we're at 7. Is the CAR score 1.2? Right now we're at 1.1. Last night. And, you know, when it gets to that level, that kind of is the threshold. And that's when, you know, like, the medical community has, like, cause for concern, and they have to start, you know, making some pretty big decisions.
Yeah.
And also the fact that, you know, and you highlighted this earlier, Chris.
I mean, you know, it's kind of difficult about that.
The governor said, let's wait 2 weeks. May
Right.
15th is not that far away.
Yeah, it's in 10 days.
Yeah.
And we saw this back in the first half of the pandemic, where it was pandemic 2 weeks at a time. Right, sir? This is in the beginning. It would be like 2 weeks state of emergency, and then they're like, oh, we're going to extend it another 2 weeks, and another 2 weeks. And then it was like, oh, let's try a month. Right? I was like, okay, let's do another
And
month.
you saw what happened when we had that story from CBS yesterday about what's happening in Oregon, right? Their governor
Yeah.
locked the entire state down through July.
Yeah. And that's because they were doing okay, and then I think now they're surging.
Because young people are getting it.
Right. And there are people out there who say, like, oh, Guam follows the states. So if there's something that's happening in the states, then we're going to see it here. And you kind of maybe do see, at least on a smaller scale, some of that. Because what's going crazy in the states right now is the UK variant. What are we catching in our quarantine? The UK variant. You know, we're getting it from the PI. It's coming from Arizona. Yeah, so obviously there's a lot to talk about. We're getting Dr. Hoa Wen of the Physicians Advisory Group. He's the chairman. He's coming on at 7. We'll talk about quarantine. We'll find out what he knows about this 137th fatality. I know a lot of people want to know, was this person who died of COVID relations, were they fully vaccinated, right? That's, I mean, the biggest question everyone wants to know. So, yeah, we're going to ask. Does he know? I don't know. We'll find out. Speaker Therese Terlahi coming on. She does every other week here on the link, so we'll catch up with her. There's a bunch of stuff going on with the legislature. Minority Leader Senator Chris Duenas. The governor had, well, after a lot of talk from the senators, the governor finally sent over a letter and said, okay, guys, I hear you talking about this $600 million. My ears are burning. Let's go meet about it and discuss the priorities. And so they wrote back and said, yeah, we're down. And the governor actually wrote back and set a date. So I believe they're meeting next week, Tuesday. All right. And so we'll talk with Senator Duenas about that. Of course, the speaker about that. Yeah, and then we're getting...
How tense a discussion do you think that's going to be?
I don't know. I'm curious. It's going to be in the main conference room, so I wonder if this is like a open to the public kind of thing, or, you know, ooh, it's a big secret meeting. Closed door. Yeah. Speaking of meetings, I was able to, Senator Moylan sent me something, and he actually had a meeting with the governor and the lieutenant governor, both about remember what's that? Let's Get Guam Moving or something? They had a bunch of bills.
Mm-hmm.
Or it's like, let's get Guam moving. And I think he had met with the governor about these measures. Yeah, so that's also going on, guys. There appears to be a lot of like bipartisan stuff happening. Anyway, it's 6:44. The show is brought to you by East West Rental, Cowboy Enterprises, IT&E, and our friends at Jack in the Box. It is the Link Wednesday, May 5th episode. Yeah, we're going in, guys. It's going to be a deep dive into everything. Some of the comments here. Chamarita Rages from Sin City, good morning. We can all be fully vaccinated for COVID-19 as a preventive measure, but not for the strains that are coming into the island. What else we got here? Tammy agrees 100% about the 2 doctors who are fully vaccinated and the need to use caution with changing anything with the quarantine. Rosemary writes, we need more understanding with the UK variant currently on island. and have people continue with safety protocols regardless of vaccinations. Okay, let's get into the news now. 6:45 for Sabrina Salas Matanani, who is not off island anymore, but is in quarantine right now. Jason Salas with the very latest. Good morning, Jason.
Yes, sir, and Hafade and good morning, Guam. Our island community this morning is grieving after learning of Guam's 137th COVID-19 related fatality, as Chris has been alluding to so far. That patient is a 59-year-old male with underlying health conditions, and he passed away at Guam Regional Medical City on Monday just after 5:30 in the morning. He was admitted that day and did test positive upon arrival. Also noted from the JIC report last night, 15 more positive cases out of a batch of 572 tests on Monday. 1 reported recent travel and was identified in quarantine. 5 were identified through contact tracing. There have now been more than 8,000 officially reported cases of coronavirus on Guam since last March, 8,004 in all, with, again, 137 deaths. 100 people exactly are currently isolated. The island's CAR score has subsequently jumped to 1.1. If you've been paying attention to it, it kind of vacillated for about a week or so and then had been sitting at 0.7 for 4 straight days and then went to 0.9 yesterday. Once again, the island's CAR score now is at 1.1. Nearly 72,000 local residents have received their first vaccine doses, and more than 67,000 of your fellow Guamanians have now been fully vaccinated. Speaking of, please book your appointment to be vaccinated. You want to check out KUAM.com/vaccination for the UOG Vaccination Clinic booking appointment URL or QR code. That clinic is started on Tuesday, runs through Saturday in Mingilao at the Calvo Fieldhouse. You can get either dose 1 or 2 of the Pfizer vaccine, shot 2 of Moderna, or the one-time Johnson & Johnson vaccine. There's also going to be a vaccine clinic going down in Talafofo at that village's gym on Friday from 9 a.m. until 3 in the afternoon. Let's go back to the newsroom now where Isaiah Uggan is standing by, and he has got the rest of the morning's Link Update headlines.
Hafade and good morning, everyone. Guahusi Isaiah Uggan with your headlines here on The Link. Guam's travel risk level has been raised back to high by the Centers for Disease Control. Public Health says the levels are based on an established formula by the CDC that takes into account the incidence rate of new cases. Nestor Lecanto reports.
The change back to high risk 3 was posted to the CDC website. The CDC raises a destination's level when the case count and testing metrics meet the threshold for a higher level and remain there for 14 consecutive days. The criteria for level 3 is an incidence rate of 51 to 100 new cases per 100,000 population over the past 28 days. Public Health spokesperson Janella Carrera.
It's an advisory. It advises those who are traveling that these are the risks that you take if you travel to these destinations. But you know what we do know is that for the size of Guam, we are a population of 160 to 170,000 people. Although the cases are between 50 to 100 over that 28-day period, we do report relatively low number of cases, although we have seen a slight uptick.
Governor Leon Guerrero issued a statement saying, "The latest designation from the CDC is a reminder that we must stay vigilant. While we have achieved our path to half goal, it was prudent that we keep our strict quarantine protocols in place to continue to protect our community against this deadly virus and its variants." The governor announced on Friday that she would be delaying the lifting of quarantine restrictions on arriving travelers. The original target date of May 1st was reset for May 15th. For Guam's News Network, I'm Nestor Lecanto.
In the past week, the Department of Public Health and Social Services has seen an increase of island residents taking advantage of the COVID-19 drive-through testing site. Here's more. It was quite busy for public health nurses earlier today as Guamanians flocked to the free COVID community testing site at the old Carnival grounds in Tijan. Nursing Resource Command Margarita Bautista Gay says that more residents are getting tested for the coronavirus. She reported that last week, Tuesday, April 27th, about 67 residents participated in the testing. Then on Friday, April 30th, 99 residents were tested. Then today, a number of 114 specimens were taken. Gay says the increase of residents getting tested can be attributed to the rising number of COVID positives on island.
I guess they heard the news yesterday or last night about the new variant, and maybe they're concerned because some had a runny nose for the past 2 days. They were worried. We don't. We're not sure, and so they're not sure too that they might. They just want to know.
Gay added that the department will continue to offer 300 Bionex Now test kits to island residents at the same location every Tuesday.
To provide testing services for people who, just want to be checked because they may have a cold or, any symptom. And so today we are testing anyone that, other than travel, are here for any concerns that with their symptoms if they want to be tested.
The governor and the legislature will meet a week from now to discuss how to spend the $664 million in federal pandemic relief the governor will be getting. Senators have been lobbying with the governor to include them in the spending discussion. The governor today sent a letter inviting lawmakers to a meeting at Adelup next Tuesday, May 11th, to discuss their priorities for the American Rescue Plan money. She sent a letter April 19th to Speaker Teresa Lahi and Minority Leader Chris Duenas asking for a collective list of ideas to effectuate a successful transition from emergency response to economic recovery. This after senators from both sides urged for more transparency and details of Adelup's spending plan. The governor's office has said it is still waiting for the money to be transferred and formal guidance on how it can be spent. That's the news for now. We'll see you all at 6 tonight on Primetime.
All right, in national headlines, millions of young Americans could soon be eligible for the coronavirus vaccine. CBS's Skylar Henry has more details on this program. He's coming to us from 1600 Pennsylvania Avenue in Washington.
A federal health official tells CBS News the FDA plans to authorize the Pfizer vaccine for children aged 12 to 15 as early as next week.
I have 2 kids in that age range, and they're both very excited to get it, and I'm happy for them to get it because I really do think these vaccines are both remarkably effective and quite safe.
Pfizer says clinical trials showed the vaccine was 100% effective in children that age and is well tolerated.
The antibody response is actually higher than the antibody response we've observed in adults, young adults. And also there were no positive cases in the study group with the data that I've been able to obtain.
Pfizer and Moderna are now running clinical trials for kids 6 months old and older. This comes as the number of adults getting vaccinated continues to drop to an average of about 2.3 million doses per day. That's down from a high of more than 3 million doses per day just last month.
To reach herd immunity, we need a certain number of the general population, including this age group, to be vaccinated.
But the number of new coronavirus cases is dropping as well, prompting more states to lift all COVID restrictions.
I think folks that are saying that they need to be policing people at this point, if you're saying that, you really are saying you don't believe in the vaccines.
But health officials are still urging caution, as the variants of the virus are now spreading among unvaccinated young adults. Skylar Henry, CBS News, the White House.
All right, and joining us now in the KUM News Zoom room, who has had a front row seat to the show so far.
Right, front row seat to behind the scenes. Let's go ahead and get in with Minority Leader Senator Chris Duenas this morning. Good morning, Senator.
Hey, good morning, Chris, Jason, and the KUM team. First of all, I want to thank you for this opportunity, to come on and talk about things that are going on within the Republican caucus and our teamwork and pulling forward. And so once again, thank you for this opportunity.
Right on. Senator, let's just go ahead and start with there was a letter from the governor about meeting with you guys. And I believe a date has been set for next Tuesday or Wednesday?
Yeah, I think it's next Wednesday.
Okay.
Interesting about that, Chris, the Republican caucus has been working very closely with the Democratic caucus. There really is what I think a very good draft list of priorities that's been put together. There's a lot of capital improvement projects, a lot of good things in there that the Republicans and Democrats agree on from the perspective of the legislature. And so before we went forward with that list, the speaker and I sent 2 letters to the governor last week. asking for clarification on funds available that are uncommitted. And so we didn't get a response from that. So I believe we'll be submitting our draft list this morning in preparation with the meeting with the governor next week. And so, just happy to report that I think the progress is being made on this front.
What do you think is going to be the tone of the conversation? And then what are some of the, because she's asking for you guys' priorities, right? So how is it going to work? Do you guys on the Republican side have your own set of priorities, and then maybe the speaker and the Democrats have their set, or is there some kind of commingling of this information?
Right. So, one of the things I'm going to be doing in this segment that you provided, Chris, is also bringing on team members going forward. And so I reached out to the team yesterday and let them know that this is what we'll be doing. Senator Moreland responded right away with, hey, can you mention that the governor has written me back a letter with regard to my thoughts on the initiatives that he introduced, the bills that he introduced, get Guam moving. And so he's had some very positive progress individually. Many of us, have bills that are working through the system. So I think first, Chris, we're starting with the bills that we've introduced. And then going forward, working from there, and then seeing what the governor has committed to, then we'll kind of have a dollar figure in terms of what's left over to continue to work on together. But I can say that the Republican caucus, the majority of the Republican caucus has met with the Democrats, and we have seen the priorities that have been laid out and are in agreement with a number of those priorities. So as a draft and in concept, I believe that when we go to sit down with the governor, of course, those who have their individual initiatives are going to push for those. But the list that's been put together has buy-in from both the Republican and Democrats at this point.
Right on. So let's just get into give me your top 5 priorities. What are you going to tell the Governor Liu? Where do you want this or some of this $600 plus million to go?
Well, I think one of the things that we have to discuss is whether the governor is still committed to this $300 million for the hospital. Right. I introduced a bill, Bill 128, and it really would kind of solidify what the governor intended or says that she has intended to do. This is to take the $300 million and put it at GITA in a trust fund that was established by the 12th Guam legislature. In that trust fund, the $300 million would be able to generate additional revenue through investment, maybe to defray the costs of architecture and engineering. That $300 million invested over the several years prior to us building this hospital, could create a lot of additional opportunities. So I think that's one of the first things that we have to figure out, because we've seen in some reports now that the governor is saying that she's seeking guidance on that $300 million to see if it can actually be spent on that. So because that's almost half of the amount, Chris, I think we need to establish that first. Is that $300 million in its entirety going to be set aside? And if it is, I would like to see that it goes, to GITA for investment purposes in an account that was set up for trust account that was set up for exactly that purpose. I think going forward from there have been mentions now by Guam Solid Waste and some of and even the utilities saying that some investment with regard to current costs and issues associated with utilities are causing issues, and we could possibly defer some increases on utilities that would really help our people. So I think we should take a strong look at that, and some of those things are contained in the overall plan. I don't want to get into the real details because I think that's appropriate to unveil, when all of us put the list forward as approved, right? But there is things like that, possibly offsetting increases in utilities. I know that Senator Moreland has had success with the governor on discussing the RISE Act. Right. I know that the RISE Act is under consideration, to make sure that we follow through on a law that was passed. We'll probably be facing a lawsuit, but that's also something that can help our private sector employees, some who probably didn't see, some of the ability to see their finances, either smoothed over or have some additional resources. So I think things along those lines, things that will provide for economic development. The one thing that I can say so far, Chris, is I haven't seen anything associated with salaries and operations, which I think is the right thing to do. Not funding new positions for the government, not backfilling operations that otherwise should be provided for in the general fund appropriations. And so, so far, it looks like a lot of the priorities really are about capital improvements and making sure that we can make it easier on our people in areas such as utilities and other infrastructure projects.
Senator, where did you see that that they were trying to see if the guidance for the ARP funds would allow them to build a new hospital? Did they put out a letter? Or?
Yeah, it was. I don't know how much. I don't know how much news organizations allow for, talking about reports on other news organizations, but it was on another media outlet.
Okay. I thought I saw something. Which kind of made me laugh because it's like we didn't check that before we started talking to them and committing this money to build this new hospital. Because it kind of seemed like...
I was a little interested. It seems like it came out about a week after I introduced my bill. And the governor mentioned, which I want to make clear on this program, the governor mentioned, I kind of was a back to the, hey, you have no authority over that money. You can't tell me how to spend that money. And I want to be clear. I'm not telling the governor how to spend that money. I'm saying, hey, Gov, if you're committed to this $300 million, by the way, this is the best use of it. Here is an account that was actually established by the 12th Guam legislature in their wisdom to use it at GIDA so that that money can be invested and generate revenue while these facilities are being planned. I don't think, Chris, just sitting in a regular bank account, $300 million is the best use of the money. So I wasn't telling the governor what to do with the money. I was saying, hey, if you're still committed to this and you've got the guidance, then put it in the trust fund at GIDA so that we can make the people of Guam's money work for us.
What did you make
but
of this?
Crystal Placos and Augustine is on the record saying that that the governor was now seeking guidance.
I remember now. Yeah. Which I mean, this whole new hospital thing. I mean, and it has been a discussion, but not at this level, for years now. But it kind of seemed like this, out of the blue. I mean, the governor just popped up one day. It's like, I want to build a new hospital in Eagles Field, and everyone's like, what? And now they're doing they've had all these other sites, but they really seem to be pushing this Eagles Field site. But you're right. When I saw that they had to check the guidance, I was like, isn't that the first thing you do? Wouldn't you do that first? Like, hey, can we even use this money?
Chris. And Chris, I don't know if you've been following the Chamorro Land Trust meetings, but there's a really kind of, even among board members and others that have been testifying, there's kind of some pushback on Eagles Field, either to compensate original landowners or return to the original landowners first. So we got to sort that out. There's also been a lot of public testimony, or at least some public testimony, either by board members or others that have joined those meetings and said, go back to OCA. Work things out over at OCA and make sure that we settle maybe any outstanding issues over there, and that I think that seems to be gaining ground as where the old hospital site was. I think is probably more popular than Eagles Field at this point.
Yeah, but we've had Lillian Posadas, hospital administrator, on, and she was very clear that her choice, and she seems to have a big say in all. Obviously, she would. Her choice is Eagles Field. But you're right, there's a lot of issues. Are they just going to give the original landowners the shaft on this, or what? Oka Point, it does seem feasible. I don't know. I mean, layman, it seems feasible because it's in Tamuning, and that's where all the other medical stuff is. But Lillian had said there were space issues. Not outer space, but do they have enough land there to build this Rolls-Royce hospital that they want to build?
And as I recall, Lillian was also saying they've got some concerns about the actual construction being so close to residential areas,
right,
too.
Yeah, that too. So, I don't know. But, I mean, at the end of the day, all this talk doesn't matter if we can't use the $300 million to build the new hospital.
Yeah, and so here we go, right, Chris? I mean, if you look at if you look at any capital improvement projects, and we now have this task force in place, right? At the end, and even in the
Another
bill that I've
task
introduced-
force, Ray. Sorry, just popped in the way.
I
Sorry,
knew
go
that
ahead.
was coming.
Go ahead.
But yeah, so if you look at it, and even the legislation that I've introduced on the 300 million really requires, and it will require on going out for any type of bond issuance. It's going to require legislative approval. So there's going to be a lot of discussion, on where, how, and all of those things. So in the meantime, if we're going to do that with the 300 million, let's make sure that it makes money for us so that we can defray costs.
Right.
But I think that the location is probably going to be something that is still going to be an active discussion. I'm a little surprised in terms of, residential area and the like on construction. We've seen a lot of construction in that area. There's in the future, there's probably still proposed capital improvements or private improvements in Tumon. So I don't know. I'm not sure that is a strong enough reason. But I tell you what, I think the biggest thing will be what happens if when the decision is being made with original landowners on the property that's being returned on Eagle. That's going to be a big point of contention, I think.
Right, because the process is when we get the properties back from the feds, GovGuam's supposed to at least offer it to the original landowners, or?
That's correct. I mean, that's what we saw in Tizen. That's what we've
Right,
seen
yeah.
in other areas. Ancestral Lands Commission is supposed to take that up.
Of course, yeah.
I believe that there are a couple of heirs that have heirs of that property that
Right.
have
That'll come
gone
out,
to
yeah.
ancestral lands and said, hey, look, if this is the plan, we want to talk to you about it. So it's really going to be complex, I think. So I think that location's still up in the air, at least from my perspective.
Right, but when I see just all the moving parts, when I see the governor come out and say, this is where I want it, when I see Lillian come out and say, yeah, I'm with you, Gov, I want it there too, it kind of makes me think that that's what they want. And, I don't even know if they factored in the original landowners into this equation. I mean, if they didn't, that's shameful.
Right. Right. So stay tuned. I think that's going to be a very active.
Stay tuned. Miss a link, miss a lot. Well, Senator, it's been good. Thanks. So appreciate it. Look forward to having you back on again.
Sure, absolutely. And like I said, besides other team members, the Republican Party chair is also very interested in joining me from time to time on updates from the party and the activity that we have going on. So once again, Chris, thanks. And we'll continue to, most importantly, work on getting the message out in the next week so the people of Guam know and understand that we're prioritizing them when it comes to the expenditure of the rescue plan. And so I don't think we can overstate that. Thanks a lot, Chris.
Okay,
Well,
Senator.
hey, Senator, before we let you go, I want to ask again, because you've got both you and you, Chris, and our Chris here have this uncanny ability to always wear island shirts on the exact same day when you come on. I want to know which Chris has the better island shirt today.
Oh, I'm going to have to give that to the host, man. That's a good looking
I defer to you, Senator, because you're wearing purple. It's
No,
nice.
that's
Cute.
you got the colors going on there, and I'm
Stop
gonna
it
have
some
to
more.
Chris get the victory on this one.
Stop it some
I'm
more.
gonna now you've set something up, Jason. I'm gonna probably run out to Macy's today or Tropical Wear or somewhere where I normally
There
buy
you
my
go.
shirts.
Injecting capital into the
Yeah, go
economy.
boost the economy. There you go. Okay,
Well done,
Senator.
Senator.
There you go.
Oh, by the way, in closing, I spent every single dime of my stimulus on Guam.
Nice.
All right. Making people who didn't get their stimulus a little bit malago, right? Right, Joe, sir? 7:09, 5th of May. Let's keep it going in the Zoom room. It's all nice and warmed up now. As we get Dr. Hoa Wen from the Physicians Advisory Group in on the link. Good morning, Doc.
Good morning, Chris. Sorry I'm late, buddy.
No, it's okay. And there's never an issue with a politician, being on for more time. They always got a lot to say. But Doc, I guess we'll just start here with this news of the 137th fatality, 59-year-old who was tested positive for COVID-19 upon arrival to GRMC, later passed. Do you know anything at all about the patient? And I guess the biggest question is, were they vaccinated, fully vaccinated, half vaccinated? Do you know?
Yeah, any patient that admitted recently are not vaccinated. Yeah, every one of them. So that's why we truly encourage people to get vaccinated, because as you have more people in the community that have been vaccinated in the past, actually your risk coming up quite a bit. So it's everyone that admitted both at GMC and at GMH are not vaccinated.
Okay, so this 137 fatality, not vaccinated.
Yes.
What else can you tell us about? Do you know anything, Doc, about the underlying conditions that this patient had suffered from?
I think, I'm not sure this one is the one that involved also. I think it's a different, the one involved in that car accident is different. But this one, I'm not quite sure if they have comorbidity, but I'm very sure that they have. It's unusual for a person that passed away. We have a few that passed away because of COVID-19 related, that have no comorbidity. But overall, for the most complication they have is like hypertension, diabetes, obesity, and cholesterol and heart disease. So more likely this person will have it. I don't know the detail of it, but it's pretty young to be passing away suddenly.
What did you say, Doc, about a car accident victim and COVID? What?
I think there's one instance that is the car accident. We're not quite sure if the patient have hypoxia from COVID or from other comorbidity that make them probably pass out. But I'm not quite sure if that one. I think I'm still not still here with us. But that's been, I think that's a few days ago. But again, that's something that we cannot discuss much because of HIPAA. So,
right. Yeah. Well, let me just ask then. This person was in an accident. Was it a fatality?
No, it's not fatality.
Okay, and so you guys aren't sure. Did they test positive for COVID?
Yes.
Okay.
The case that we are positive in the hospital are accidental. They come in there for surgery,
right,
or they come in there for, and before they do that, we have to test them. And if they test positive, the question is that, hey, is that COVID-related hospitalization or not? Just because, the question that they have for a long time, or because remember, you can test positive up to 3 months, if you pop the pass.
Right. And so this person that was involved in this accident, what did you say? Hypoxia? What is that in English?
Remember, COVID-19 have caused for the silent hypoxia. And that means that you drop your oxygen so low that you don't know about it until it really hits you and it becomes symptomatic. That's why we encourage people in the past that they have COVID-19 infection that's positive, that they buy a pulse oximeter to just monitor the oxygen level in the blood. Just because the oxygen can drop and your body does not respond normally to hypoxia like other disease. It will hit you and suddenly you have shortness of breath and you're down in the 80% already in your oxygen.
Interesting.
Yeah. So hypoxia is something that we're looking for in patients that turn positive for the COVID-19.
Wow. Doc, what about these 15 more positive cases from a batch of 572 tests run on Monday? 1 reported recent travel, 1 is identified in quarantine, 5 were identified through contact tracing. 15 positives. I see a number like 15 in a time like this, and it really sticks out.
Yeah. As we open more, we released more restriction in the past, right? You're going to see a lot of people out there in the community going to gather a whole lot. So we expect fully that the positive will go up. And, but the key here is that as you have more people immunized, the CAR score or the positivity rate in the community will probably grow a bit larger, but the hospital admission hopefully will stay down. And that's the purpose of the vaccine, is that if you have the virus, you're not that sick. That the severity of the virus that caused illness in the past is much, much less severe, that you don't end up in the hospital. Again, in order for us to keep the positive rate down, is that we encourage people that when they're sick, to not go to any gathering or not go to work, and don't mingle with other people unless you get tested, and you make sure you test negative before you do that. That's the only way that we can ask community to do things like that, to kind of keep our positive rate down lower. So we have to keep reminding people about their illness.
So these 5 identified through contact tracing, do you know if it was related to any of the clusters that we've been talking about?
There's a few out there that we test positive in the clinic, Chris, that is not related to the cluster. I think the cluster, the Sobaki and the A Lounge, it passed 2 weeks and about 1 to 2 cycles already. So that cluster should be somewhat decrease or resolve quite a bit. So this is probably from any positive in the community that the public health do the contact tracing.
What about the quarantine, Doc? A lot of people are a little upset about the quarantine policy. Hasn't changed, and I understand that's because we delayed the reopening of the island because of these clusters, right? But is there still discussion on, or is it just tied together that we're not going to change anything with quarantine until we reopen? What's the status?
The new quarantine guidelines have been finalized. It just depends on when the governor feel comfortable to release it. It's either on the 15th or 16th of this month, or depend how she make a decision. But when we have not in the past required any pre-arrival PCR to be implemented, just like in Hawaii. And so that's one of the new guidelines that we're going to require that for people to come in, especially if they unvaccinated. So we do a few things that is not done in the past, just to try to mitigate any type of infection coming from traveler. So we have some new stuff that we're going to implement, try to make sure that when people come in, that they test negative before they come in.
We had a question here in the comments. Francisco writes in, ask the doc, with the population of Guam getting vaccinated, will the COVID strains become more aggressive or stronger towards those who are not vaccinated because the virus cannot find a host carrier?
Yeah, when I think any type of new strain most likely would come from the traveler and not from local infection, because as as we have more travel coming in and out of Guam, there's a risk that you have a variants that come in, right? Just like the UK variants, California variant. So it's not so much of you have a variance from Guam, it's a variance from other people. Now, the more people get vaccinated, remember the vaccine we use right now are working on those variants. Okay, and none of those variants that they have right now, because the covariants of concern, mean that our vaccine are working to protect you against those variants. So I think the chance that we have local variants is very rare. It's just that from other part of the country is much, much more prevalent. And more likely it will be here in the community. But again, that's why we hope that more people come out to vaccine so that way we can protect the island.
Doc, what about other types of sick visits at the clinic level? What are you seeing?
You know, right now, what we've seen is a lot of non-COVID related sick visit. Again, both hospitals are pretty full on other non-COVID related admission like heart attack, stroke, and other complications of those chronic illness. Because people have been kind of put that off during the past year or so because they either get nervous about go to a clinic because of COVID-19. So they kind of and that change their lifestyle. They stay home a lot. They're not exercising. So we see that those non-COVID related comorbidity, create quite a bit of problem with our patient right now. And I say there's quite a bit more admission, and most of the time, both the hospital are full with non-COVID related admission.
So you're seeing a lot of patients playing kind of catch up, right, with things that they maybe didn't pay attention to for the last year?
Yes. A lot of people come in just to try to do their laboratory tests just because they haven't done it for about 6 months to a year already. We really encourage patients also to make sure that I know the pandemic in the past year changed a lot of people's lifestyle, but we need to get back to somewhat a near normal lifestyle. That exercise, what will you eat, and go see a physician to make sure that whatever you have has been taken care of and take your medication.
Right, guys. Yeah, go see your physician because the silent killer, hypertension, high blood pressure. Doc, going through this pandemic and just being stressed and having anxiety about, you could die from COVID, that wears on a person, right? Those types of situations, do they affect like the hypertension and the high blood and all that?
It does. People are afraid. They stay home a lot. And, when you stay home, you become very sedentary, and that raises everything else there. Your weight go up and everything else go up. It's encourage people to exercise. Go walk in the park on a Paseo or the Asan, or any way you can walk out in the open environment. You can't really catch the virus or anything else from other people if you just walk in an outside environment. So I encourage people to take time to do that. Every time I pass by Asan, I see a lot of cars there. I'm really happy to see that.
Yeah.
The bicyclists on the road, those things that is wonderful for us as physicians. The people are trying to be active in the lifestyle. So, kudos on those that are trying.
Keep it up, guys. Put Dr. Ho out of business. Get healthy.
It's okay. I'll be glad to do that.
You go fishing, right? Doc, we had a comment here. This is Rosemary's, man, this lady's on it. What is being done for those individuals where doctors advise them not to receive the vaccines because of their medical conditions? And is that a significant number of people, Doc? And if you could go over again, like what are the medical conditions that a person might have where you would say, oh, you can't get the vaccine?
Yeah, that is very, very rare. If you have severe allergic reaction to any type of vaccine that require you to have an EpiPen administered to you, those are the patients that most likely would say, hey, you might not be able to get the vaccine. On the elderly, depend on their comorbidity. If they are really frail and have a lot of comorbidity, we rather have the people around them get vaccinated and take care of the people because they might not handle any type of response to the vaccine. Even with patients who have cancer that are on immunosuppressive medication, we still encourage to get it. They might not have the response to the vaccine as much because they've been on medication suppress the immune system, but we still encourage to get them. The only thing is that the only one that I and other physicians recommend not to get yet is during the early pregnancy. Late pregnancy during third trimester is okay, but first, second trimester, I know Dr. Shea will do that too. That we encourage people just to wait until later on during the pregnancy stage to get the vaccine. But again, there's very rare case that we tell the patient not to get it. We rather protect everyone around them.
Okay. Anything in closing, Doc?
Again, just remind people, if you're sick, please
Stay
go
home!
get okay, stay home. Go get tested. Don't go to gathering. Don't go play sport. Don't go to work until you get tested have negative. So that's the only thing I can tell you, that to go forward along with the vaccine, that you will see a decrease in the positive rate in the community. So, and the other one is that vaccine we have a lot. There's no shortage of them. So please go out there and get to any location and get vaccinated.
What did you think, Doc, of this idea with GVB where they want to attract Americans who are living abroad to come to Guam and get the vaccine? This vaccine tourism deal. What are your thoughts on that as the PAG chair? Is that something that you think is feasible? I mean,
we don't have the shortage vaccine anymore, because we have a lot, between the current vaccine and the community health vaccine. There's a lot of vaccine. I'm not sure we can get enough vaccine on people's arms, because we're going to have excess, and we don't want to return the vaccine. So, a lot of expats that live in Japan and the Philippines and Thailand, everywhere, that, they don't have the vaccination where they are. So GVB idea of bring those expats back to Guam and stay, just to increase our tourism economy, to help the economy of Guam. I think it's an excellent idea, because the bottom line is they all are U.S. citizens. They are not foreigner. So to bring them back, and a lot of them want to come back to get the vaccine to protect themselves in those countries. But I think it's an excellent idea that they think outside the box to do that. So I would say that I would support that for them to open a program for the U.S. citizen that live abroad, the expat to come to Guam, because that's the close point to get vaccinated.
Last question, Doc. Relative to vaccinations, the FDA, I know, has started the discussions to give vaccines to children as young as 12. Is that something that's being looked at here? Because I know right now 16 is the cutoff.
Yeah, I think by next week we should want to give vaccine to 12 years old and older. So that's something that we looking to see how the best approach to get the 12 and older to get vaccinated. There's quite a bit of them out there. So and remember, as a minor, you have to involve the parents.
Right.
So you have to kind of administer the vaccine to this minor. You have to pay attention. Hey, the parents have to work too. You can't do that in the middle of the day. The parents can sometimes cannot get off work to get vaccinated. So we have to start planning to see. You have to work some type of late evening hours, so the parents will be off and to be with their minor to give consent for the vaccination. So that's something that they need to start planning and not giving the vaccine the middle of the day, because parents cannot make it, and you cannot give the shot without the parents.
Okay. Thank you, Doc.
You're welcome, guys. Be safe, and 3W always, okay?
That's it. You got it. We'll see you. 3 W's, okay? Especially graduation season. 7:29. It's Wednesday, 5th of May, 2021. Go ahead.
Yeah, Dr. Nguyen was just saying, like how well stocked we are and everything, and we want to remind people, like the story we reported yesterday about the order that GovGuam put in for the new batch of dosage for May, I believe 33,000 in total.
Wow. And so that's why Dr. Ho was saying that, we're not short of the vaccine. So in case you saw that and wondered if we are, I guess we aren't.
was it February when we ran short? Like just like
yeah, it was
maybe
kind of
like,
recently, right?
Yeah, like a day or two before the month ended,
Yeah,
and they were saying it was like, well, this is the shortest month of the year, so that wasn't unexpected. But I remember there was a little bit of a dust up over that.
Right, yeah. 7:29, guys. We're going to take a really quick break, and the Speaker of the Guam Legislature, Speaker Therese Terlahi, is coming up right here on the link at 7:29. Good morning.
Make it. June makes the best malasadas in Hawaii, a fact not lost on Daryl, whose brother Byron is cooking the onaga he caught at his secret fishing spot with his girlfriend Malia, who used to work for the Shave Ice Guy, whose second cousin Vince drives the school bus ridden by Calais, whose auntie makes the best malasadas in Hawaii. Everything here is connected, and with the new First Hawaiian Bank mobile app, you can stay just as connected to your finances, and it all starts with yes.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
The relationship between Guam and Manila, Philippines is undeniable as we share similar cultural traditions, history, and heritage, with generations of Filipinos calling Guam home. KUAM presents a monthly look at the capital city featuring in-depth and engaging interviews on everything from medical tourism to new business and government leaders. Veteran newscaster Nestor Lecanto delivers Beyond Our Borders. This special program is brought to you by the Bank of Guam and KFC.
Family platter of fried chicken? Check. Tray of red rice?
Check.
Birthday cake?
Check.
1 case of water?
Check.
12-pack of beer?
Check.
2 cases of Pepsi?
Check. When you have a long checklist but are short on time, we got you. Get it delivered by us. Order on the app or website at uno-go.com. Guam on demand.
Shoot, I forgot the paper product.
Oh wait, UnoGo has that too.
After a year with so many games and events delayed or unplayed, the world is ready for anything and everything in the world of sports. KUAM Communications is ready with more games, more championships, and more specials that are guaranteed to bring out the fan in you. Don't miss a minute of gameplay from NBC on KUAM TV 8 or from CBS on KUAM TV 11. Every month, we'll bring you the action and excitement. Brought to you locally by Michelob Ultra, Superior Light Beer, and Docomo Pacific. Just more great reasons to tune in and turn on so you'll fall in love with TV again with the best from KUAM Communications.
KUAM's multi-platform morning show, The Link, just got a little more delicious with Feed Me Fridays. Chris, Sabrina, Jason, and the rest of the morning crew will take some time each Friday to talk food, taste food, and bring you all the latest and greatest in food from King's Restaurants and Ruby Tuesday Guam, old faves, new hits, and everything on the menu in between. It's Feed Me Fridays on The Link.
KUAM Communications and Denny's Guam presents Mamapreneurs, a special multi-platform series throughout the month of May showcasing mothers who are also local entrepreneurs in our community. In commemoration of Mother's Day, during weekdays in May, we'll feature daily profiles of these multitasking mamas and their businesses. Additionally, on KUAM News Primetime every Monday in May, we'll showcase a different enterprising mamapreneur. Check out our online directory of all these businesses as well on KUAM.com. And if you know a mamapreneur we should feature, send us a message on social media or email executiveproducer@kuam.com. Mamapreneurs is brought to you by Denny's. Guam's Diner is always open.
It's Dirty Politics Weekly on The Link, live on location. Every week, Chris and Sabrina will interview different political leaders out in the field to address environmental problems in our community. See firsthand how illegal dumps, littering, and other issues are plaguing our beautiful island and what's being done to help. Part of our Sustainability Matters campaign for Earth Month, in partnership with the University of Guam Center for Island Sustainability and Guam Green Growth. Presented by Green Energy Solutions, Inc. Reduce before you produce. GESI.
Catch SportsLink on the KUAM News Morning Show, The Link, every Friday to hear about the latest in sports news, game schedules, athlete profiles, and more. SportsLink, brought to you each week by Cure Alkaline Water, airs every Friday across the multimedia platforms of KUAM. Tune into the broadcast on Breeze 93.9 FM, on KUAM TV 11, live streaming through the KUAM News Facebook page, or view highlights on YouTube, KUAM News Facebook, and Instagram. SportsLink is hosted by Dave Delgado through KUAM Sports, and he will make sure that everyone knows what is happening on the fields, in the gyms, and everywhere in between.
The world of television is more exciting than ever. Don't miss a minute of special presentations from NBC on KUAM TV 8 or from CBS on KUAM TV 11. Every month, we'll bring you the fun and excitement of award shows and red carpet moments, special series presentations, and other great network programs. Brought to you locally by King's Restaurant, Ruby Tuesday Guam, Bud Light Seltzer, and Docomo Pacific, giving you more reasons to tune in and turn on. Fall in love with TV again with the best from KUAM Communications.
Looking for TV schedules, upcoming sports, or special presentations, or what you may have missed over the busy week you had? Well, look no further than KUAM Digital Digest. This weekly emailed newsletter puts all kinds of information in the hands of subscribers each and every week. Just subscribe and we will make sure you keep up with your favorites and stay informed and entertained throughout it all. Go to KUAM.com, click on the newsletter tab, give us your email address, and you are all set. Brought to you in digital partnership with King's Restaurant and Ruby Tuesday Guam. It's the KUAM Digital Digest, your weekly guide to the latest information and best entertainment on the stations and platforms of KUAM.
Sahaji bibi bunu ko agi jalau sati ma kwaita tok tung ma bi sin tu ra ventas mama isinona sakumu ko ha tu mo tu ka panas lona esta grita na pabia patengang ni naimu munga zuma tengang apa ajengang zuni pilitimu sana mono zuma ngota torak kazuinyamu lu zakatan dan manu teru adula bosa tazapanu.
Hey, good morning. Hey, good morning. 7:37. Facebook Live. Hi. The show is brought to you by East West Rental, Cowell Enterprises, IT&E, and our friends at Jack in the Box. Jay, when are we going to do our milkshake morning?
I think we should do that for Sabrina's first day back when she's physically back in the studio.
Oh, and face to face.
Yeah.
Guys,
milkshakes for everybody.
In case you didn't hear, Sabrina Salas Mantonani is on island now in the quarantine facility.
Milkshakes for breakfast is the thing to do. We're going to make it a thing.
Right.
We'll get that trending.
We should do like Milkshake Monday or something.
You know, I wonder have the senators ever had like milkshakes in session?
I don't think they... There's probably something with the rules, right? Are you allowed to drink milkshakes on the session floor, Madam Speaker?
Many years ago, Speaker Don Parkinson had an ice cream machine. I was just telling my staff about this. And he had it, and they had a room next to the session where they would have food, drinks, and he brought in this commercial soft serve ice cream machine. And he was very picky about how it was mixed and made. And so I remember him like supervising that very closely. And of course, it was like a treat for everybody, but it was really unusual because the machine's huge. I've never seen one before. Before that was years ago. And
God, was it better?
No, I haven't. In this building, we really aren't doing any food. Staff, they do their own lunch, but otherwise, no ice cream on the
Yeah,
session floor.
because the damn
or
media, the media is too much on the scrutiny now. You guys cannot have a buffet without everyone getting all, oh, how much did it cost? Like, how was that ice cream, though? Was it as good as E-Pen?
It was good. I don't know about E-Pen, but E-Pen's is the best.
So that's interesting. A guy was
We
just
take strolls for that. Yes.
right. Yeah, I always wanted a soft serve ice cream machine in the house. Okay, let's get into official business now. So, Madam Speaker, I guess we just wanted to, first of all, as the health chair, get your reaction on this extension, delay, whatever you want to call it, for the reopening of the island due to the clusters. Of course, I know you know that they kind of put a 2-week pause on everything, including the quarantine modifications that were set to go into place if we reach the path to half. And it's a little funny to me, well, not funny, but that we reached the path to half, which was kind of like one of the finish lines that the governor put out. But then because of the clusters, that ended up being so anticlimactic. So just what are your thoughts on this delay of 2 weeks?
Well, I'm not going to question whether we should have gone into a delay, but I do know that this delay is causing huge impacts to people who are trying to plan, right? And so it really makes planning very difficult, planning your businesses, planning your personal travel. We've got lots of travel going on for graduations or things like that, taking people out to school and just business travel. And it's really, I know many people have put their travel off until our quarantine requirements change. And now that they're not changed, it's really setting things off. So yeah, that's difficult. So, I just hope that we can contain these clusters as soon as possible, that we have a strategy going forward to do it very quickly, no matter what clusters or no matter what strains come in, that we are going to be able to detect those quickly and stop them. I asked the governor, about should we reconsider exemptions to quarantine? Is this something that we should be concerned about? Is this how the variants are getting in and getting around? And she was very adamant that no, we should not change our exemptions. These are critical workers, and so they need to continue to be exempt. I'm just concerned that they're not just being exempt from the hotel quarantines and quarantine at home. They're going to work, every day. So there is exposure. And I think nobody can deny that. So that's just a concern. And we're just going to have to be I think businesses who have people who are critical workers who are being exempted from quarantine are going to have to look on their side and do something to protect all the other workers when these critical workers, come back.
Right. There was
just to create some kind of limited contact so that we can control it quicker in case.
Yeah, and I mean, we've seen with the case of these two doctors coming from India, it also happened with the guard returning from their deployment to D.C. Because of all that stuff that went down in the Capitol. But they had come in, the doctors and the guard, with their negative tests, but eventually ended up popping positive for the virus. So, yeah, I mean, they call it ROM, the restriction of movement. So when you get exempted from the quarantine as an essential worker, not only do you get to avoid going in the hotel, they allow you to travel to and from work and also conduct any other essential business, which would include going to the grocery store, for example.
Yes.
So it's not just going to and from work. There's a lot of wiggle room. And, human nature, you give an inch, take them out. Oh, if I can go to the grocery store, well, why can't I go eat lunch? Or, if I can go, I just need to go pay the power. Right? So, yeah, I mean, they seem really firm on not doing away with the essential worker thing, but maybe the conversation we should be having is, do these people need to be more closely monitored?
Or just, like, for example, if I had that in my workplace, I would make sure that when they do come to work, that we know exactly who they are in contact with, just in case, that we continue to monitor, because it's very clear that despite, being vaccinated, despite the PCR test, that travel increases the risk. That's clear. Yeah. Nobody denies that. And so we just have to act like that. So we just have to know who in our workplace has been traveling and just keep their contacts a little bit limited, for that period, just so that we can track it quicker.
Have you been satisfied at all with the level, the quality, and the rate of information that has come out about these clusters?
But, I've been very vocal with public health during oversight hearing after oversight hearing with the information that they are releasing to the public. I always thought they could do more. They should do more. It took them forever to do that. But recently, I'm very happy that the information that they were releasing had details. It told us, where these contacts were being made. It told us even businesses, and they told us just kind of activity that I thought was helpful for the public to then adjust their own behavior, right? And that's, for example, perfect that they announced, a certain cluster from this hotel, anyone who ate during these certain dates should get tested. That's what we have been asking for since the beginning, right? It's like, tell us where you found it so that we can get tested if we feel like we've been in contact with those. And then we've seen a response. So the community has responded because we have a very smart community. And that's why I always believe you give them the information, they're going to respond appropriately. And so I'm appreciative of the information that they've been able to share. And, of course, when they share travel now, they're telling us exactly travel from where.
Right.
And that's very helpful. And I think so that just if we know, I work with someone who's been traveling from this place where they have variants that have been found on Guam, that we need to just be more careful or get ourselves tested or, just to be sure.
I think the information that a lot of people are wanting now, though, with these positives that come out, is they're wanting to know, were they vaccinated? Were they half vaccinated? What was the status of the vaccination?
Yes.
So it took so long, but it took so long for public health to kind of like evolve. I mean, and part of it was like they were responding to, a raging fire of a pandemic here, but it took them so long to kind of evolve in disseminating the information. Do you see something like, are these COVID positives vaccinated, half vaccinated, or whatever? Do you think that's valuable information that the public?
Absolutely. Of course it is. Of course it is. Because we're, the public is judging, whether what our leaders are telling us is true or not. And so they just want to judge for themselves, and I think, so far what I've heard from the doctors and the governor announcing in public health is that everyone who's in the hospital was not vaccinated. And so that was one of the claims of this vaccination, was that it was going to lessen the severity of your illness, lessen hospitalization. And so it sounds, just from these initial numbers to be true, or at least, I'm optimistic that kind of news is going to help people to make the decision, those who are still on the fence as to whether to get vaccinated or not, that they're going to see that it's those who are not vaccinated who are still getting hospitalized, that we might all get this illness, but whether we're going to be hospitalized or die from it might depend on whether we were vaccinated or not.
Speaker, let's switch gears a little bit. There was something I saw you had put out about Agent Orange, and I know you've been like the one who's been leading the charge with the Agent Orange. So what was that latest development?
So recently, one of the military's veterans organizations, they call it Military Veterans Organization, Inc., they filed a request with the Veterans Administration that the Veterans Administration recognize a presumption that anyone who had served in Guam during these years who claimed to have Agent Orange illnesses stemming from that service, that they were presumed to have been exposed to Agent Orange. And this is the same presumption that is used for people who were in Vietnam. And if they claim to have suffered from these certain illnesses, then they are given that presumption by the VA right now that they were exposed to Agent Orange. And so that has been expanded now through a lawsuit and congressional action to, other places around Vietnam, waters surrounding Vietnam, but it hasn't been expanded to service on Guam. And so, of course, we've been debating, back and forth over years, and it's not started with me, it's years before me. Many, many people came out to talk about this, especially veterans, especially residents of Guam who witnessed it, who said that, herbicide had been sprayed on Guam during those same years. They believe it was Agent Orange based on, their recollection of what the barrels looked like, the effects. And but the Department of Defense has outright denied they ever had Agent Orange on Guam or that they used it on Guam. Outright denied it. That's why you've seen us over the years, EPA, Guam EPA, federal EPA actually joined together to do some testing to see if we could prove this or not. And it's very difficult after this many years to prove it, right? Because these things degrade the elements, right? So anyways, this veterans organization has filed a presumption with the VA, or a request. The VA denied it, and so they filed an appeal in the court, federal district court. And so I joined in as an amicus, friends of the court, to also file a brief in support of the veterans organization and requesting that the court, require the Veterans Administration to make a rule that recognizes this presumption. And attached to the briefs in this case were report after report of the contamination that has been found on Guam. You know, we've had Superfund cleanups here, a couple of them. And so they had to make formal reports. We have reports, of different areas on Guam where we find these things. And of course, we have affidavits from veterans. We have affidavits from residents of Guam as to what they've witnessed and what they have experienced. And these illnesses are they're exactly the same illnesses that the presumption recognizes for other places.
So would you characterize this as is this a big move of a piece on the board for you?
Well, it's great. It's a big piece because Congress finally recognized, they called them blue water veterans for having been exposed. And they did that after a court case, also finally recognized it or forced, demanded that the VA also recognize the presumption for them. So this, I think, just helps to put the evidence out there. It helps to put these affidavits out there, the veterans out there, and so it helps to urge the VA to act. And if not, I'm hoping it's going to help Congress to act as well, because we've tried to tackle this on many fronts. So we do resolutions here in support of congressional actions. We've met with these congressmen who are in support of that recognition for Guam, and they can do that legislatively back there as well. So we're very much in support of that and hoping that that's going to happen this year, with the new majorities back there. So we're hoping it's really justice for these people who have been exposed, who suffer these severe illnesses. And it's tragic, that it's years, so many of them have passed. And so I just want to do my part while I'm in office to continue this fight that actually started years ago. It started Robert Celestial, Angel Santos, Ben Pangilinan, many of them have fought for years. Even Mark Forbes, was established a blue ribbon panel. Tina Muñoz Barnes, all of them have been working to get recognition that, or it's not even just the compensation, but it's the health care for those people who are suffering. And it's that recognition of a disability caused by their service, right? That's important for them, and that's justice too.
Let's move to a different topic. What do you expect out of the $664 million meeting with the governor next Wednesday, and what are some of the big ticket priorities for the legislature?
Well, I'm going in there in good faith, very optimistic, expecting that we've got pretty much, a general agreement with senators here. And we want to have an agreement with the governor that, these are the big priorities for Guam. This is how we're going to help our people the most and the most directly. And this is how we're going to help our businesses to recover quickly. And this is how we are going to act consistently with what Congress intended, with these funds. And so I think really it's in everyone's best interest to have an agreement, that we can't use this as an opportunity to, I want this one thing, and if I don't get this one thing, no deal. I think we're going to all have to compromise a little bit, but I think it's going to be better if we can all agree, because this has huge impacts, not just, on the use of the money, of course, on people's lives, but it has huge impacts on our budget, our own government budget going forward. Right. And so I think everyone has to recognize that these all are intertwined so inextricably that it only makes sense that we are going to come to an agreement.
Right, Madam Speaker, but how do you characterize this? It's almost a 180 from the CARES Act, where the governor was pretty much with the horse blinders, like no one can tell me how to spend this money, you can't appropriate it, to where we are now. I mean, I wouldn't call it a complete 180 because there's nothing finalized and we don't know, there's no indication, what the plan will be and how much of your requests will be honored. But the fact that you guys are getting a seat at the table, I mean, like I said, it's a far cry from what we saw last year. So how do you plan to really take advantage of this opportunity and make you guys' mark?
Well, we've been working very hard with the assistance of the Office of Finance and Budget here at the legislature. They've been able to do some analysis for us as to, what we were, where funding, first of all, what funding was short and what does that entail? What does that mean? What programs or services are not being provided because of that? Second of all, just kind of the estimates that we have gotten from agency, they have a good compilation of those as to if we are going to, impact this, how much does that cost? So things like that. We are, of course, hoping to get, for example, the RISE Act, that's direct payments to people, right? And of course, that was a unanimous decision by the former legislature that just in, last year, that we see this as the greatest need, that people who are in categories of income, less than that amount, that they are going to get some assistance and that they can spend however they need to spend, because we recognize, rent, utilities, just cost of living, everything is, really impacted them. So that's number one. And as you remember, the RISE started off at 400. We doubled it. I doubled it by my amendment to 800 at the time. And so, of course, we still stand by that. And we expect that the governor is going to implement that from whatever funding source. And we gave her that flexibility to use whatever funding source. But these funds, for sure, if it hasn't been done by then by all means, these funds should be used for
Man, Speaker, I know this RISE Act is a real big talking point with the Republicans, and you as well. But I gotta say, the need is real. Like, I don't know where the governor is, and I think the issue she has was that the GovGuam employees aren't getting any of the RISE Act or something, and so she was talking about, it's not fair or whatever. But when I go around, Madam Speaker, people are always asking me to ask about the RISE Act. Just yesterday, I was picking up lunch at Chamorro Village. This guy was like, hey, can you ask what's up with the RISE Act? So, I mean, it's real. Yeah, people are kind of like expecting because it was a law, right?
Yeah. Well, when you say the need is real, I absolutely agree with you 100%, 300%. I agree with that. That the need is real and it's so evident. And unfortunately, we say businesses are opening, people are getting back to work, some of them, but they are still, it's been so long that the impacts just compile on top of each other and they're getting to be complex now, right? And so that's why we recognize just recently in a bill that was passed for the BPT bond to refinance it, we asked that some of the proceeds of that saving or some of the savings from that refinancing of the business privilege tax, that go immediately to food assistance, because we continue to see the long lines. The mayors make it very clear that the people in their villages are in need. I don't know of any mayor who thinks otherwise. And the limited times that I actually go out and meet people in public, because those are still limited right now, they're always bringing that to my attention, that they still are in need. They're critical of, can we get more assistance? Can we get it faster and things like that? So, I absolutely agree that the need is there.
I'm just not comfortable, Madam Speaker, with us having to explain because at the end of the day, it's a law. I mean, it just reminds me of that $10 million that was supposed to go to the Guam Memorial Hospital.
Yes.
I mean, there are laws that the administration is just choosing to ignore. And that's, to me, I'm just not comfortable with that example. And I don't like how we have to sit here and say, the people really need it. The people really need it. Like it's a law at the end of the day to pay it out. So.
Well, now there are two laws, right? Saying pay pay some assistance out, and they've honored some of the other laws.
Yeah.
So it is perplexing. But I hope that is not going to be the case moving forward, because I'm telling you, this is, if we're going to sit here and quabble about money, for the next 2 years, how we spend this money, and we can't come to an agreement, then I just think that's a loss for everyone. Because even while we're paying it out, people will not feel satisfied that we've done our best. They're going to, be critical the entire way. And I just feel like if we're going to rebuild Guam, let's rebuild. Let's grow. Let's move forward and give everyone the confidence that we are doing our best. They are part of it. That the sacrifices that they are making are part of, just helping all of us, and that no one's sacrificing alone, and no one's sacrificing only, while the others benefit. And that's one thing I really don't want to see, is that we pick and choose who's going to benefit, and not necessarily get those who are in most need.
Madam Speaker, thank you for your time. I got to run. I'm at the top of the hour, but we definitely appreciate your time here on the link, and have a great day.
Thank you. Take care, everyone.
Esta, 7:59. We're coming back on KUAM TV right after this.
We got your 6.
At 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. Guam. My name is Chris.
I'm Jason. Good morning, everybody. Half a day.
Hello. Welcome to the link. To our viewers on KUAM TV, good morning on you. Looking great this morning. It's 8 o'clock.
I wish everybody could have seen, well, TV's just joining us right now, but everybody on Facebook, that little anecdote that Speaker Therese Terlahi shared about the legislature used to have like an ice cream dispenser.
Yeah.
That was gold. You're not going to find that on Wikipedia. You're probably not going to find that on Guampedia.
Yeah, you won't.
That's the only thing you're going to find here on this show.
Yeah, maybe they need that. Put an ice cream machine back in the legislature. Kind of chill it out a little bit. Sometimes it's a little contentious. I like that, but, ice cream is good. It's my favorite.
Ice cream machine, popcorn dispenser,
right.
Some nachos maybe.
Tabasco.
Oh, there you go.
Right on. It's 8:01.
I mean, they tried the chili dog thing, but that didn't
work out so well, did it? Wednesday, May 5th, 2021. This is the link. Sabrina Sauce Mantanani checked in at hotel quarantine right now. Dusitani, Nestor Lecanto of the KUAM News team also checked in at the Dusitani. He was sending me questions for Speaker Therese Terlahi, so they're both working very hard this morning.
They checked in, then they timed in.
Right, yeah. So I think Bree's going to join us tomorrow.
Nice.
Right.
I can't wait to see that view.
Yeah.
I wonder what floor she's on.
Man, Joe, she's going to steal your thunder with her view. That's going to be fun. I told her, I was like, yeah, you come on, and we just like talk so much smack about this. She's like, I'm not going to talk about the quarantine. Are you kidding? I was like, oh yeah, you're stuck in there. I'll talk about it.
Well, Nestor and Bree are now the third members of our news team who have been at the Dusitani in quarantine, because Adriana did it when she came back from the States when she was on, like last December, I want to say.
Yeah.
And I did a couple video chats with her and everything like that. We collaborated on some interviews, but I was like, hey, can I see your view? Absolutely stunning.
Yeah. It's probably one of the best views on Guam. So there you go. Silver linings, guys, of being in quarantine. It's 8:03. Good morning. The show brought to you by East West Rental, Cabo Enterprises, IT&E, and our friends at Jack in the Box. Coming up, Major Anton Uggan, the Department of Corrections. There's a change coming down at DOC, which we'll tell you about on the way. Also, looking for Labor Director Dave Della Sola to pop on the show. We've got a little bit of Harlem Hikes here. I'll take you out to Tarzan Falls
Oh, yes.
at 8:04. Let's go ahead and get into the news. There's always a lot to talk about here. Of course, Jason Solis has more details on the 137th fatality, COVID-related fatality, and the COVID reporting from last night at 8:03 again. For Sabrina Salas-Mantanani with the very latest from the KUAM News team, Jason Solis, good morning.
All right, good morning and thanks, partner. And good morning, Guam, everybody watching on KUM TV and on Facebook. It has been a melancholy morning as far as news headlines, as our island community is collectively grieving today after learning of the island's 137th COVID-19 related fatality. The patient, a 59-year-old male with underlying health conditions, passed away at GRMC on Monday just after 5:30 in the morning. He had been admitted that day and did test positive upon arrival. Also noted 15 more positive cases from a batch of 572 tests on Monday, one recent travel, and that person was identified in quarantine. 5 were identified through contact tracing. There have now been more than 8,000 officially reported cases since last March, 8,004 in all, with once again 137 deaths. 100 people exactly are currently isolated. The island's CAR score has subsequently jumped to 1.1. Remember, Dr. Felix Cabrera during a press conference last Friday said 1.2 is the threshold metric at which they really start beginning to plan. It had been sitting idle at about 0.7 for about 4 days. Then it went to 0.9 yesterday. Again, Guam's CAR score today, 1.1. Nearly 72,000 local residents have received their first vaccine dosage, and better than 67,000 have now been fully vaccinated. Speaking of, please book your appointment to be vaccinated as check out KUM.com/vaccination for the UOG Vaccination Clinic, which runs through Saturday at the UOG Calvo Fieldhouse. There, you can receive either dose 1 or 2 of the Pfizer vaccine, shot 2 of the Moderna, or the one-time Johnson & Johnson vaccine. There's also going to be a vaccination clinic down in Talafofo at that village's gym on Friday from 9 in the morning until 3 in the afternoon. In other news, the second cycle of the Emergency Rental Assistance Program is now accepting tenant pre-applications. GovGuam got $33.6 million to aid renters impacted by COVID with rent, rental arrears, utilities, and utility arrears for up to 15 months with payments made directly to landlords and utility agencies. You can find the forms on KUM.com or go down to the ERA office on the second floor of the ITC building in Tamuning from Monday through Friday from 8 to 4. The Guam Department of Education is encouraging students to enroll in summer school, which runs in both face-to-face and online formats from June 7th through July 16th, with classes held Monday through Thursday. The deadline to submit application forms is this Friday, so please get them in. You can go to KUM.com, our website, once again, to access the PDF application. Longhorn Steakhouse, as you know, has made its way to Guam and, for the second week, is seeking employees to help fire up its grill. Today, the steakhouse will hold a job fair at the location in Tamuning near GPO from 9 a.m. until 5 in the afternoon. That starts in about an hour. They will be hiring for kitchen and back-of-the-house positions. Residents must apply in person only, and experience is not needed but certainly beneficial. Their sister companies, Applebee's, Pyology, Olive Garden, and IHOP, are also seeking to hire staffers. Let's go back to the newsroom now to see what Isaiah Uggan has for us with the rest of this morning's headlines with your Wednesday Link Update.
Hafa and good morning, everyone. Guahusi Isaiah Uggan with your headlines here on The Link. Guam's travel risk level has been raised back to high by the Centers for Disease Control. Public Health says the levels are based on an established formula by the CDC that takes into account the incidence rate of new cases. Nestor Lacanto reports.
The change back to high risk 3 was posted to the CDC website. The CDC raises a destination's level when the case count and testing metrics meet the threshold for a higher level and remain there for 14 consecutive days. The criteria for level 3 is an incidence rate of 51 to 100 new cases per 100,000 population over the past 28 days. Public Health spokesperson Janella Carrera.
It's an advisory. It advises those who are traveling that these are the risks that you take if you travel to these destinations. But you know what we do know is that for the size of Guam, we are a population of 100 and 160 to 170,000 people. Although the cases are between 50 to 100 over that 28-day period, we do report relatively low number of cases, although we have seen a slight uptick.
Governor Leon Guerrero issued a statement saying, "The latest designation from the CDC is a reminder that we must stay vigilant. While we have achieved our path to half goal, it was prudent that we keep our strict quarantine protocols in place to continue to protect our community against this deadly virus and its variants." The governor announced on Friday that she would be delaying the lifting of quarantine restrictions on arriving travelers. The original target date of May 1st was reset for May 15th. For Guam's News Network, I'm Nestor Lecanto.
In the past week, the Department of Public Health and Social Services has seen an increase of island residents taking advantage of the COVID-19 drive-through testing site. Here's more. It was quite busy for public health nurses earlier today as Guamanians flocked to the free COVID community testing site at the old Carnival grounds in Tizan. Nursing Resource Command Margarita Bautista Gay says that more residents are getting tested for the coronavirus. She reported that last week, Tuesday, April 27th, about 67 residents participated in the testing. Then on Friday, April 30th, 99 residents were tested. Then today, a number of 114 specimens were taken. Gay says the increase of residents getting tested can be attributed to the rising number of COVID positives on island.
I guess they heard the news yesterday or last night about the new variant, and maybe they're concerned because some had a runny nose for the past 2 days. They were worried. We're not sure, and so they're not sure too that they might. They just want to know.
Gay added that the department will continue to offer 300 Bionex Now test kits to island residents at the same location every Tuesday.
To provide testing services for people who, just want to be checked because they may have a cold or, any symptom. And so today we are testing anyone that, other than travel, are here for any concerns that with their symptoms if they want to be tested.
The governor and the legislature will meet a week from now to discuss how to spend the $664 million in federal pandemic relief the governor will be getting. Senators have been lobbying with the governor to include them in the spending discussion. The governor today sent a letter inviting lawmakers to a meeting at Adelup next Tuesday, May 11th, to discuss their priorities for the American Rescue Plan money. She sent a letter April 19th to Speaker Teresa Lahi and Minority Leader Chris Duenas asking for a collective list of ideas to effectuate a successful transition from emergency response to economic recovery. This after senators from both sides urged for more transparency and details of Adelup's spending plan. The governor's office has said it is still waiting for the money to be transferred and formal guidance on how it can be spent. That's the news for now. We'll see you all at 6 tonight on Primetime.
All right, thanks, Isaiah. Getting back to education news, IT&E will continue their distribution of the MiFi devices for this week. Of course, they were the winning vendor in the Providing Access to Homes program, which affords qualifying families the opportunity to receive 100% federally funded mobile wireless devices, providing 50 gigabytes of data per month to support distance learning. IT&E's MiFi distribution schedule for today, Wednesday the 5th, is from 4 to 7 in the afternoon, down at the Sinahani Mayor's office in the central part of the island. On Thursday, also from 4 to 7, they'll be up here in Dedido. And then on Friday, 3 to 6 p.m., up in Jigo at Simon Sanchez High School. You can check KUAM.com for the full list of qualifying criteria for, once again, for GDOE and IT&E's PATH program, how you could qualify possibly for a MiFi device. In national headlines, millions of young Americans could soon be eligible for the coronavirus vaccine. Skylar Henney with CBS has more details from the White House.
A federal health official tells CBS News the FDA plans to authorize the Pfizer vaccine for children aged 12 to 15 as early as next week.
I have two kids in that age range, and they're both very excited to get it, and I'm happy for them to get it because I really do think these vaccines are both remarkably effective and quite safe.
Pfizer says clinical trials showed the vaccine was 100% effective in children that age and is well tolerated.
The antibody response is actually higher than the antibody response we've observed in adults, young adults. And also there were no positive cases in the study group with the data that I've been able to obtain.
Pfizer and Moderna are now running clinical trials for kids 6 months old and older. This comes as the number of adults getting vaccinated continues to drop to an average of about 2.3 million doses per day. That's down from a high of more than 3 million doses per day just last month.
To reach herd immunity, we need a certain number of the general population, including this age group, to be vaccinated.
But the number of new coronavirus cases is dropping as well, prompting more states to lift all COVID restrictions.
I think folks that are saying that they need to be policing people at this point, if you're saying that, you really are saying you don't believe in the vaccines.
But health officials are still urging caution, as the variants of the virus are now spreading among unvaccinated young adults. Skylar Henry, CBS News, the White House.
And now with the Island's daily news update in Chamorro, sponsored by our friends at First Hawaiian Bank, here's Uncle King Conception with your Chamorro news update.
Buenos tardes to get sunto gifino Chamorro ni KUAM News. Presenta ni Familia Mizo gi First Hawaiian Bank. The Centers for Disease Control para CDC sama ati sa tati gi gradon 3 iris kambueta paraguahan. Adjuna grado sa 4 kilo. Manujig statemento ginin adalob nua epo kitaw-tawta na haso na debrita fan akmata. Lenya magahaga luliong raw na aplaso komunidad ni Tsenegunia pero masen na dahi punofan ni natin ni COVID-19 na chatnud. Lo tahaslo ko na kaya magpo estina pesti. Taza yung sigidas manahuzang ni CDC hafa na mahatsay gradon riskaw. Lo islata sa mali natisan nuevo na grupo pa clusters dyan natisan man ni natin na taw-tawta gi mapos na 2 semana. Igradon 3 sa kumikilingin na debi man babuita umas kapazi adusihan na klasen lugar kumuti presiso na parang faktu. Igubendo sa tsonik tati 2 semana na tempo ipamaribahay rekang kinarentina para man mafatumagi na pasahero gidia uno gimadzu. Gito artikulo ginika pa dirito na ding mestra ni pesti ni manahano ni public health para guato gi CDC gi 3 na 4 na mestra sa ma-identifika as the variant gin ni United Kingdom. Magkasadera na adso na variant is SARS-CoV-2 sa sanadet manatmi para otro taw-taw siya. Adso siya na sampo sa manafanenon desde Enero estay abrid na mes pagunasakan dagin na din mamates siya na bisita no mama-quarantine gi fasilitadad gobernamento ni rinipori KUAM gi matsa na mes na public health maresibi resito ni mestra siya gin ni CDC no kinonfirma na 7 gi 26 na muestra sa ma-identifika na variant gin ni California. Según itinatisan niya reglamento ni Public Health, adso siya na bisita sa manma-quarantine gi fasilitadad ng gobernamento. Adso siya na pasahero ni manmates na positibo para COVID-19 di QFAC sa manafanyaga gi sagang quarantine ng gobernamento. Dadyo siya manarima gi adso siya nitawtawagan ni maninazi sa manma-quarantine para 14 dias anti tufan matransferi huzang gi komunidad. Putoro esta 61 na mestra ni virus masamiti guato gi CDC para di genome sequencing. Di masasunto, gobyerno dyan niya legislatura sa parufan ali giyon semana na tempo para madiskuti tayo mano para magasta adi 664 milyon pesos ni para tafan manay no federal po na sistem ni isla po di pesti. Isenador siya sa hakas mafaisin na gobyerno pero fansano siya gyadyo na diniskuti. Ginigap gobyerno sa katalsi legislatura para kumbida guato gifasinan niya gimatis dia on sige madzu pero madiskuti at mas presiso siya na ginasta ginadya American Rescue Plan na salapi. Ananogi Speaker Teresa Lai, dyan magas minod, si Senador Chris Duenas, zapafasin pasalistan idea siya, pero manufacture itinalay ka na rin respondo ng emergencies tagwato gihinamlo ekonomiya. In fin esti, después si Senador siya gitodi ros banda ni partida, maepag yung gobyerno, para na mas klaro yung planunya, no tamano para magasta este na salapi. Ilang yung opisina ng gobyerno na mananang ka justi pago salapi, dyan ifutmat na yung naskayan, dyan na konser ni tamano sina magasta. Otro mas, Segundo na cycle para emergency rental assistance na programa gini Departamento ng Administrasyon sa maaksesepta pago aji tenant pre-application. No riniport ni KUAM na premyo guahan 33.6 milyon pesos gini Department of the Treasury para yung nadzuday man manatkikila guma gini isla. Este na programa sa para assistin sa mga manatkikila siya na maninefekta ni COVID-19. Maninadzuday gyat kilon gasto ni hanam sa ni candid sa kuntod izi minita siya. Esta hulog 15 meses na tempo. Adto siya na sa lapis sa sempyo manay direktamento gato gidoy na lugar dyan yahin siya utilities. Este na inasisti sa tiakurbia di siya DB, antes di address Gimatsu 2020. Inform siya sa sinon hakot gi www.doa.guam.gov. Pasinaw ang suli gi opisina ni ERA, gi segundo bibenda gi ITC building, lunes hasta viernes, desde las 8 gi egan, hasta las 4 gi pupuengi. Para más informasyon, agang 638-451-849. Y asunto gi finut sa moro sa presenta sa ninafatto ni familia Mizo gi First Hawaiian Bank. Para Guam News Network, Guau Sikin Conception.
All right, there you go. Chamorro News with Ken Conception, brought to you by our friends at First Hawaiian Bank. 8:19. Good morning, Jason.
Good morning.
Right on. Let's head right into the KUAM News Zoom room where we have Superintendent of Education John Fernandez sitting by on what's looking like Island Shirt Wednesday.
Off today. Good morning.
Morning, Superintendent. So we'll just get right into it. We'll get you on every week to provide an update. As we kind of wind down towards summer, what are some of the things that you guys are working on now?
I wish I could say that we're winding down too for summer, but I want to say that. But I'm in the car right now because we've been out in schools every day, and I'm just preparing, in a few minutes to go start a tour of LBJ school here, and then we'll hit Tamuni Elementary, Chief Brody, and JFK later this morning. And I think we're maybe a week away from finishing all the schools. But we're doing this because we really want to grapple with the challenges that we have to bring our kids back to school face to face for 5 days of instruction next year. That's really our goal. And as we go school by school, we're working, looking at how they're organizing their classrooms, looking at what help and support our schools need. Some of the challenges or issues they might face in the common areas, the cafeteria, to see what we can do to provide solutions so we can have our students return to what will hopefully feel like a regular school year. I think right now what I can say is that we do have maybe between 10 to 15 schools who say that already that they're ready to go for 5 days of instruction. They're able to get all their students back. They don't have the space issues. But as you get further north and as you get to schools of higher populations, it becomes a challenge where we are very close, but we're not quite at a point where we can say that every student can come back. Right. So we're pushing it. We're trying to figure out ways to assist the school. We need to help clear equipment and furniture out of the room so that you can maximize more desks and more students. If we need to switch out desks because you're using shared tables instead of desks, what can we do to purchase more, of these desks with the federal funds that we have, and so on and so forth. So we're in that solution finding mode. Ultimately, though, I think we're going to really need to talk to public health and the lieutenant governor and the governor about where we think we might be, in a month or two, because I think if we have just a little bit more flexibility with the safety parameters, we might be able to reach our goal. And what I mean by flexibility is that, a lot of these safety measures are put in place, in isolation. So, the distancing is assuming you might be sneezing and someone needs to be at least 6 feet away in order to maybe minimize the risk. But, when you layer the distancing on top of the face mask, on top of the hand sanitizing, the frequent cleaning, we think we're creating and we're maintaining a safe environment from what we've observed. And we'd like to see if there will be any more flexibility to give us, on a school-by-school basis, the opportunity to make the adjustments and so forth that we need to bring our kids back and do it safely based on the school's, the school's plans and the school's setup. So that's what we actually have a meeting today, this afternoon. Chairman Mark Mendiola, Vice Chairwoman, Dr. Mary Okada, myself, and the Lieutenant Governor, and I believe some of the public health representatives too, to start this conversation so that if we can make decisions soon, it'll really help us with the planning for next school year.
John, I know that you guys are encouraging students to enroll in summer school, which is running in both face-to-face and online formats from June 7th through July 16th. What's the response been? with enrollment?
I don't have a count just yet, but I know that our concern is that that we might not get the enrollment that we want because summer school is not required. But we know that it's important for our students to have the opportunities to come back and to participate either in our academic programs or hopefully with other partners in the camps and programs that our partners are conducting. So we really have been working to push the information out through our school networks, through our parent-teacher networks, and through our mayors, and we'll continue to do so through the end of this week, and then we'll have a better count as to what the schools are reporting in terms of registration. But I do, again, we just really want to put the word out there that we know our kids, the kids that we see coming back to school really enjoy being back with their friends. They've done a great job as far as we've been able to observe, following the rules. I mean, it looks like all the kids are used to the mask, used to the hand washing, the hand sanitizing, even down to the kindergarten level. So, we're really encouraged by that, and we do hope that more students and families will take advantage of the opportunity to keep their kids engaged over the summer.
John, is this latest delay of the reopening of the island and just some of the clusters, has it altered at all you guys' plans for next school year?
It hasn't altered our plans because, we've been looking at this as a game plan to get us from where we are today to August. So it's important that we monitor and we keep up to date with all the latest guidance and the latest developments that are happening around the island. So at this point, we do share the concern and we do share the need to take a cautionary approach to further reopening because, we are, even though we're still at a very, low and acceptable level in terms of the new cases and positive cases that we're seeing, we know that further uptick will put us into different categories of risk, which may force us to think about whether or not we're really ready to bring families back for the coming school year. So we're not there yet. I do think that the governor's put out that cautionary note. I would do the same to all of our members of the community, the same way I do with our athletes, our students at school. If you want to keep going in this direction, if you want this opportunity to come back to school, to come back to your activities, we have to follow the rules. We have to make sure we're safe. And we have to, remind ourselves, remind each other to, not be relaxed and not let our guard down. Let's keep practicing what we need to practice until we get the vaccinations, further along and we hear better news about the ability for, to bring this virus under control.
John, I know you're about to get down at a school and do a tour, but I wanted just real quick to get your reaction on this letter that Congressman San Nicolas had sent to the budget chair, Joe San Augustine. I don't know if you're able to get eyes on it, but basically what the congressman, the title of the release is Congressman San Nicolas Defends Education, and I guess the takeaway is that he's urging the budget chair to not reduce local appropriations to education just because they've received a significant amount of federal funds.
Right. I did have a chance to talk to Congressman San Nicolas about a week and a half ago, and our conversation was exactly about this issue. He wanted to know, how we were doing in terms of the expenditures of the federal funds, what we were using it for, what our strategy was to use the funds going forward to help our kids return to school. And so we did just have that discussion. He did ask about the local budget situation, and I did inform him that our biggest concern is determining whether or not there will be commitment by the government, and I mean by our legislature and by the governor, to meet the maintenance of effort requirements that are really required in order to access these federal funds for our children. And so that maintenance of effort does set forth the formula for calculating the minimum level of support that needs to be appropriated to the department. And so we're working with the governor's office and the legislature to clarify whether we'll be able to meet that maintenance of effort. And if that level of funding is met on the local side, that will allow us, to use our federal funds to really supplement and support the reopening of schools, and that's really the intent. So if the maintenance of effort is met, then we should be in good shape. If not, if the legislature seeks a waiver and we use these federal funds to replace things that we were going to pay for anyway through the course of a normal school year, it just means less money is available to go to those unfunded areas that we've neglected for such a long time, including facilities, our facilities repairs, and other items that we've had to address.
Interesting, because I'm pretty sure other agencies are kind of facing the same thing, where we're seeing, if GVB is getting $20 million, then we deduct that from the local funds there.
Well, I'm sure they are, and I think that's probably the impetus behind the $660 million that of course was provided to the governor for to help offset the revenue impacts from the pandemic. And then of course I know the earned income tax credit payout will really help us here on Guam. So I think the resources, there's a lot of resources flowing into the island. I just want to point out that when it comes to the education funding, that's where Congress put in that specific requirement for maintenance of effort, and it said, look, the intent here is not to use these funds to just replace funds that were lost, but really it's a partnership where they're looking for a local commitment to maintain a level of support for our schools, and the federal funding will then come on top of it, so we can get our kids back to school. And I think that's a critical part of our reopening strategy, anyway. So that's our focus, is using these funds for, the sustained reopening of schools, get our kids back safely, keep them in school safely. And we think that's going to be fundamental to all the other plans to reopen the island, because our parents need to go back to work. They need those jobs to return. They need to be back earning for their families. And many parents can't do it if they're going to be asked to stay home, provide childcare, teach their kids, be the technology specialists at home, and so forth. So we're doing what we can, and we're working with the governor. We'll work with the legislature as we get closer to budget season to sort those things out.
All right, John. Appreciate your time. Hey, but just real quick, so for August, we're looking at full-on face-to-face. I'm sorry, my son was asking me. I mean, I should know.
Well, come August, we still are allowed for parents to sign their students up for online. But other than that, everybody else is going to come back for face-to-face instruction. The question is whether it's going to be for 5 days or whether we're going to have to alternate days based on the number of students. So that's a decision. That's the issue we're trying to work on right now. And I hope it'll be back to 5 days so that our kids can come back, get back into the routine. Maintain a very steady stream of communication and engagement with their teachers and classmates. I think that's the goal for all of our schools.
Right on. Thank you, John. Appreciate your time.
All right. Thank you. We'll talk to you next week.
Okay, that's that. There you go. John Fernandez, GDOE Superintendent. Like he said, it may be summer coming up, but they're still working hard. 8:31. Let's keep it in the Zoom room here where Dave De La Sola is so gracious to join us. Our labor director. Good morning, Dave.
Good morning, Chris. How you doing today?
We're doing pretty good. Thanks for hopping on. Just real quick, I saw you had put out a release making a call for anybody who's on the PUA in need of submitting paperwork, that they would need to submit that paperwork. Can we just start there? What was that about?
Well, when the Continuous Assistance Act went into place in January, the feds, as part of the act, required that all PUA claimants, that we send out notices that they had to submit all their documents and identifications on their claims to keep them valid. And anybody, of course, submitting a new claim would also need to start submitting their required documents in order to continue to get payment. So it was kind of a housekeeping move, because we've always required the documents as part of the claimant's requirements. and the SEP notices, any check stubs, your vest and identification, and anything else that helps prove that, number one, you are in the workplace and working. Number two, that you either had a separation or a letter from your employer saying that you're reduced in hours or separated or laid off, furloughed. And then, number three, then any check stubs that shows that, your typical hours before the pandemic and where you're at now to show that you are reduced in hours. Those are the typical documents that you would have. And if you already had them in your account, then you're golden. You don't have to worry about it. But if you didn't, then per the federal guidelines, we needed to give out the 21-day and a 90-day notice to everybody to get it in there, or else we can't take action.
Right. I also saw something where you guys had a positive case. Was that at the call center?
Yes, and it turned out to be a false positive, if I'm using the term right. So the girl had a vaccine, started exhibiting some signs, got tested, got a positive, and was feeling okay after that. And we were told that it might be, and I don't know what the right word is, or a false positive from the vaccine. Got tested on Friday, came back negative. Everybody that was around her came back negative. So they said, out of abundance of cautions, let's retest her one more time. So she got tested on Monday. We're just waiting for the results to come in. Then everybody will be back to work.
Right on. So
our call center is still operating, but it's at a severely reduced level. So we would prefer all those that are at home waiting to come back to work either later today or tomorrow are monitoring the PUA.hotline at dol.guam.gov. So we encourage everybody to, if you have questions or need help, to email that somebody will answer you by email. That's what our staff is doing at home, working the email until hopefully, like I said, if the second test comes back negative, then everything will go back to normal.
Right. Dave, on that note, I wanted to ask, because we had Chima Mbakwem, Chief Medical or Chief Public Health Officer, on yesterday, and he had talked about specifically, but I'm sure this comes up a lot during the pandemic. He had talked about specifically there were 60 Subaki Tower employees who had to be quarantined, home quarantined, because of possible exposure to the virus or whatever. And I don't even know the details, whether Subaki paid these employees while they were in quarantine, whatnot. But just long story short, I had asked him if these employees were not paid, or any employees from any private business who, because of a risk of exposure or, out of an abundance of caution, were advised to take 14 days off of work, are they eligible to recover that lost income with the PUA program, since their absence from the job would be COVID related? And of course, Chima was like, I'm not Dave. You got to ask Dave. So I'm asking you.
Yes, you are. And if you looked at one of the 11 criterias, there is one of the criteria is either you were you either have COVID or contact tracing or something, but it's really, I forgot the exact verbiage, but there is a criteria for that. And yes, all you would need to do is get some kind of note from public health that says that, yes, you are mandatory quarantining. It doesn't matter if you have COVID, it could be through contact tracing, but because of COVID, then you would just use that, upload it, file your claim for those weeks, and you would get paid.
There you go, guys. There's your answer.
Can't say it easier than that.
Right on. Dave, what about on the fraud? And it's been a couple of weeks since we heard anything about any additional fraud cases. Are they out there?
There are always a few here and there. I'm happy to say there's not a lot, but there are some, and they have been forwarded either to the AG, the FBI, or the OIG, and they are taking that and running with it. And all we're doing is doing our best to supply them with the information to make the determination of whether to move forward or not. And once we give it over to them, then we kind of wash our hands of it and just give them the information so that we can keep moving forward and keeping the money going out. That's our main goal. So we don't hear any big feedback after that. You know, they don't like to share a lot of information. They are the law enforcement.
Right.
And we have our hands full with just making sure that we just do the deterrence. And that's what they were, is that to show to the island that there are deterrents, they are getting caught, and please don't do it, because we don't take any pleasure doing this kind of stuff.
Right.
And I hate to see our brothers and sisters taking advantage and then having to pay the price. We get no pleasure out of it. So that's moving forward. But there is something that I do want to mention while I got you on the air. And
please do. Please do.
You know, we are trying to shift into the training. And I'm trying to get the word out there as early as possible so that we don't get hit with the floodgates in September, even though I know what's going to happen.
Yeah.
But I do want to let you know that the AJC is open. Their number is 475-7000. But if you are laid off or furloughed and you're looking at a new career opportunity or have an interest in some training, then the first step that you should do is to email ajc.training@dol.guam.gov. So that's ajctraining@dol.guam.gov, and just let them know that you're interested in training programs with your name and contact, and we will reach out to you with a survey to kind of get you an understanding of what your situation is, how do you qualify, what you're interested in. We'll start working with you with what trainings are possibly available, and if you qualify, then it could be free paid training. So you could get a $2,500, $3,500 course, with certificate course in various home care or IT or certified nursing or truck driving or construction, entrepreneurship. There's all kinds of different types of training that I'm trying to work very rigorously with the training providers to put together classes. These will be, anywhere from several weeks to longer, but these are certificate types classes that you have something in your hand and that you can take. Some of them have jobs attached to them when you graduate. Some of them will give you a certificate into a demand-driven occupation so that you should easily get a job, with this. And these are usually all decent paying jobs. So whatever your interests are, now is the time to put in that interest, get you in the system, get you pre-qualified, and so that you can figure out when the next training course is and get you signed up, because they are limited because of the contact tracing. The sizes of the classrooms are not the usual size normally, and get you going and get you early and get you start the training, and hopefully we can get you into a new career path.
There you go. And Go Guam, once you're in, that's it. Set for life.
We can help you with that too, but that's mostly DOA.
Right, yeah, that's DOA.
But there's work experience, on the job training, apprenticeship. There's all kinds of different things that are available. If you are aggressive enough to come down and beat on our doors and make enough noise, we'll help you.
Thank you, Dave.
Thank you, Chris, for having me.
Appreciate you more. Thank you. 8:42. Guys, we got to take a break. Yeah, because that was like how many interviews in a row? Oh, I was cramping.
That's good news about skills training.
Yeah.
And Dave has been, the many hats he's been wearing at DOL, because, he was helping people with the pool and then, telling people where they can get contact information. But he has always consistently said, make sure you get your skills training up, prepare for, that next move if something's happened to you, unfortunately, in your employment status and everything, because you don't want to be one of those people who's going to wait in a very long line like later on this year. So
Yeah.
take advantage of that, man.
Yeah, there's a lot of things to take advantage of during this pandemic, and that's one of them. I mean, you could emerge from this mess with like a whole new skill set.
Yeah, like you said, medical coding is something that probably like a lot of people like locally don't consider. But I mean that can be a very lucrative career. Data processing, like you were saying, like IT. I mean, tech is the thing to get into. You can go in a million different places. Like if you have serious tech skills.
Yeah.
Apprenticeships. You've got those very specialized things. I mean, there have been a couple of forums we've had like already. This is maybe 6 months ago there were some things like that. But I mean, those kind of positions are needed.
It's 8:43. Facebook Live. Joseph A. Castro writes, half a day from College Station, Texas.
Hey, Texas A&M.
Bev Test J.
Giga Maggies.
Bev Test J. Solis writes in, John Fernandez and Daphne Shimizu should be nominated for the most informative government employees.
Let's put Dave on that list too, because
Right.
Dave's fantastic.
Yeah, so if you're on our Facebook Live, thank you so much. Our viewers on KUAM TV, good morning. It's brought to you by East West Rental, Cabo Enterprises, IT&E, and Jack in the Box. We're back with more of The Link next.
Looking for
Make sure you're connected. The writing's on the wall. 'Cause if your mind's neglected, stumble you might fall.
Connection is a human necessity, one we need today more than ever. And with the new First Hawaiian Bank mobile app, you can stay just as connected to your finances. And it all starts with yes.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
The relationship between Guam and Manila, Philippines is undeniable as we share similar cultural traditions, history, and heritage, with generations of Filipinos calling Guam home. KUAM presents a monthly look at the capital city featuring in-depth and engaging interviews on everything from medical tourism to new business and government leaders. Veteran newscaster Nestor Lecanto delivers Beyond Our Borders. This special program is brought to you by the Bank of Guam and KFC.
Family platter of fried chicken?
Check.
Tray of red rice?
Check.
Birthday cake?
Check.
1 case of water?
Check.
12-pack of beer?
Check.
2 cases of Pepsi?
Check. When you have a long checklist but are short on time, we got you. Get it delivered by us. Order on the app or website at uno-go.com. Guam on demand.
Shoot, I forgot the paper product.
Oh wait, UnoGo has that too. KUAM's multi-platform morning show, The Link, just got a little more delicious with Feed Me Fridays. Chris, Sabrina, Jason, and the rest of the morning crew will take some time each Friday to talk food, taste food, and bring you all the latest and greatest in food from King's Restaurants and Ruby Tuesday Guam, old faves, new hits, and everything on the menu in between. It's Feed Me Fridays on The Link.
Catch SportsLink on the KUAM News Morning Show, The Link, every Friday to hear about the latest in sports news, game schedules, athlete profiles, and more. SportsLink, brought to you each week by Cure Alkaline Water, airs every Friday across the multimedia platforms of KUAM. Tune into the broadcast on Breeze 93.9 FM, on KUAM TV 11, live streaming through the KUAM News Facebook page, or view highlights on YouTube, KUAM News Facebook, and Instagram. SportsLink is hosted by Dave Delgado through KUAM Sports, and he will make sure that everyone knows what is happening on the field, in the gyms, and everywhere in between.
The world of television is more exciting than ever. Don't miss a minute of special presentations from NBC on KUAM TV 8 or from CBS on KUAM TV 11. Every month, we'll bring you the fun and excitement of award shows and red carpet moments, special series presentation, and other great network programs. Brought to you locally by King's Restaurant, Ruby Tuesday Guam, Bud Light Seltzer, and Docomo Pacific, giving you more reasons to tune in and turn on. Fall in love with TV again with the best from KUAM Communications.
KUAM Communications and Denny's Guam presents Mamapreneurs, a special multi-platform series throughout the month of May showcasing mothers who are also local entrepreneurs in our community. In commemoration of Mother's Day, during weekdays in May, we'll feature daily profiles of these multitasking mamas and their businesses. Additionally, on KUAM News Primetime every Monday in May, we'll showcase a different enterprising mamapreneur. Check out our online directory of all these businesses as well on KUAM.com. And if you know a mamapreneur we should feature, send us a message on social media or email executiveproducer@KUAM.com. Mamapreneurs is brought to you by Denny's. Guam's Diner is always open.
After a year with so many games and events delayed or unplayed, the world is ready for anything and everything in the world of sports. KUAM Communications is ready with more games, more championships, and more specials that are guaranteed to bring out the fan in you. Don't miss a minute of gameplay from NBC on KUAM TV 8 or from CBS on KUAM TV 11. Every month, we'll bring you the action and excitement. Brought to you locally by Michelob Ultra, Superior Light Beer, and Docomo Pacific. Just more great reasons to tune in and turn on so you'll fall in love with TV again with the best from KUAM Communications.
We got your 6.
At 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Me run out of gas, me not a star. Me run out of gas, me not a star. Watch it. So me push me car to a gas station. Fill it up, turn up me radio. Guess what? I play up on my stereo.
The link.
Guess what? I play up on my stereo.
The link up.
Reggae music, some reggae music. Hey, reggae music, some reggae music. Reggae music, some reggae music. Hey, reggae music, some roots music. Little have it that me sight up me brethren. Little reasoning in a this time and season. Little have it that me sight up me sister.
Oh man, God, so good. 4-piece band. You feel this? 8:50 Wednesday, Hump Day, May 5th, 2021. Good morning. Coming up, Cover Me, which is brought to you by Burger King and Docomo Pacific. This is the link. My name's Chris. Right on. Sabrina Salas Mantanani is in the Dusitani quarantine hotel. So is Nestor Lecanto. They have our news team. The irony is that media has been deemed essential. But the process, right? You can't just go to get off the plane and be like, I'm essential. Look at me. There's a whole process. You have to submit a letter. You have to submit a letter from your boss. You got to have your negative test. And you have to do this all in advance, guys. In case you don't know, because now that they battle-bolted us on the quarantine policy changing on May 1st. It is what it is, guys. I mean, we were told pat the half. You meet the pat the half. You go get your vaccination. You're going to be rewarded. You're going to be rewarded with returning residents who are vaccinated won't have to go into quarantine. Anyway, that's what they said. But because of these clusters, that whole thing was just out the window. But the recommendation is still with the governor, the recommendation from the Physicians Advisory Group to change up the quarantine policy. So it's still happening. Bree and Nestor are there in the quarantine, and we don't know when it's going to change. But what I was going to say was there are a lot of people who are coming back based on that information that they had that come May 1st, if we achieve the pat the half. And, our people aren't stupid. They pay attention. I know family members in the States who were watching how many vaccinations we were getting because they knew that once we got that pat the half, that meant May 1st, the trigger, boom, we're going to open an island. But because of these clusters, that decision was delayed for 2 weeks. But does that necessarily mean that, we need to hold steady with the quarantine? I don't know. It's a discussion that's obviously being had. But then, kind of tempers it a little bit is those two doctors who came back from India who didn't have to go into quarantine, who eventually tested positive for the COVID. And because of that, well, they sent the samples, or at least one sample from one of those doctors, off to the CDC to check if it was like the India variant or whatever. So, yeah, a lot of people made plans to come back after May 1st thinking that they weren't going to have to go into quarantine. So if you do have some type of essential status, and it really comes down to your job. I don't know if there's a master list of what jobs are deemed essential or what positions are held by what they call CSWs, critical service workers. But if you guys are already, because, I know it is, you don't just buy a ticket the day before you leave, you buy the ticket, in advance, right? So if you guys are trying to get an exemption out of quarantine, you go on Public Health's website. It's dphss.guam.gov, and then /quarantine. And that will take you to the forms that you need to fill out, and there's a guy you email, and they check it every day. But just do it in advance, okay, guys? That's the thing is, don't do it on the plane on your way over, because it takes them time. And I only know because I'm familiar with the process. It takes some time to review the documents and to even make a determination. And you know what? With public health, they move on their own time. So it doesn't even matter if you have all your stuff in and you call and you say have all your stuff in. They got their own clock over there at public health. So there's no guarantee they're going to get to it when you get to it. So doing it in advance. Okay. It's 8:55. Yeah. So we were talking a little bit about the CAR score, and because they really, it's the metric that they use, right, to show us where we're at in terms of COVID risk and whatnot. And so just looking at the story that Jason read earlier, Guam's CAR score has subsequently jumped to 1.1. It had been sitting at 0.7 for 4 days, then went to 0.9 yesterday.
And even before that, it had been, kind of like what we call, if you follow the stock market, it oscillated a lot. It was jumping up and down because we had 6 cases, and then we'd have 2 cases, and then we'd have something like that. So for about maybe a week, we saw 0.2, 0.6, 0.3, and then it went to 0.5, and then 0.7 for 0.7 for a while, and now 1.1.
Which is why I don't even really personally pay attention to the CAR score. There, I said it. I don't, because to me, that doesn't make sense. It doesn't match the severity of what we're being told the situation is. You know what I look at is I just look at the positives and the hospitalizations. Just keep it simple. Because this CAR score, no one else uses this CAR score, first of all. So if we call the CDC and we tell them, hey, why did you bump our risk status up? And by the way, that did happen. Non-essential travel to Guam, according to the CDC, should be avoided. And if you look at the countries that we're listed with, we're with Chad. Did you see that?
Mm-hmm.
That's so.
Japan is also on there too. Yeah. There are several. We're there as well.
Yeah. So even with this CAR score being 1.1, which is still, according to the CAR score metric, that's still way low. It is. And the problem I think that, I have with the CAR score is that, again, it's a formula that was created by Dr. Cabrera. And remember when they came out with it, it was like, oh, we got to use this CAR score. We even did something on the CAR score. But what I found interesting was when they came out with the CAR score and said, hey, this is going to be the metric that we're going to measure with, it was like the CAR score was 42 or something, right?
Yeah.
Remember, it was some crazy
And back then, we
were
averaging at the high point, we were getting 103 positive cases. The numbers were eye-popping for our population.
Yeah. So when I see a CAR score has subsequently jumped to 1.1, it doesn't mean anything to me because I've seen a 42 CAR score. You know what I'm saying? And I'm not even hating, guys. You know me. I'm a stay home, be safe kind of guy. I'm just saying, that's why people just have a hard time trusting the decisions that are being made, because some of these explanations, and especially if you're just going to throw numbers out at people, they need a little bit more than that to go on.
I think that's fair for me, because I mean I'm a nerd, right? Like,
Yeah.
I'm all about math.
Yeah.
I mean, maybe
And that's the thing, is like the CAR score, like I said again, they don't use this anywhere else. And I wonder, like, if Dr. Cabrera is out for the day, like, do we not get a CAR score? Because he's like the only one who knows. Like, Jason is a math wizard, and you can't even do this math.
There's one part that I haven't been able to figure out. Can we take a look at the
Yeah,
actual
yeah,
calculation?
of
Okay,
course.
Joseph, you got that graphic, right? Okay, so at the bottom, I hope this comes out on your screen, right? Real quick.
Yeah.
So the CAR score is computed by the daily new cases per 100,000 residents, right?
Mm-hmm.
Then multiplied by the square root, take the square root of the quantity, the test positivity rate, multiplied by the effective retransmission rate. Now, daily new case by 100,000, we get that.
You just killed 6 of my brain cells reading that.
Well, we get that from the JIC, and then you can calculate, the square root of the test positivity rate, because that's out of how many samples, how many were positive. The effective retransmission rate is something that, at first glance, like on paper, I can't suss out. I remember when we have talked to Dr. Cabrera before, and I even asked him, I'm like, I'm an algorithm guy, you're an algorithm guy. The one thing about algorithms is that
I'm an algorithm guy. You're just a couple of algorithm guys.
well, because he designed this, and I was like, the nature of algorithms is they always have to evolve, and they have to like adapt to the environment in which they operate. And he said this is already like the third version of it, and granted, this is an old graphic. We got this around like July.
Yeah,
August.
but that's what I'm saying. It's like
Yeah.
you don't even know what the form. I mean,
So there
what
may
kind
there
of
may
number?
be calculations that have been adjusted or
Yeah,
coefficients that have
that's
been
what.
added.
Let me just go back. So when we saw a 42 CAR score, remember the governor was kind of like wanting to reopen the island for Thanksgiving, and so we saw that CAR score go from like 42 to, and remember it was strive for 5. Right, so we were told 5. Oh, that's okay, it's acceptable. But then right after they said strive for 5, they were like, yeah, but we kind of just want to put it at 2. And so you saw that CAR score just plummeting down, right? And I want to say we were seeing similar numbers as to what we're seeing now. And so how I look at it is like, are they able to finagle the calculation to kind of suit what direction the governor wants to move in? Yeah. I mean, no, I'm not even crazy, guys. I'm just saying it was weird how we were told again that a CAR score of 2 is sustainable, but now we're supposed to be flipping out because it's at 1.1. You know what I'm saying? And
Well, what he
that's
was
the
saying
thing.
again, like what he was saying, Dr. Cabrera, that should be in last Friday's press conference, was what they use is if the CAR score gets to 1.2, then they really start to pay attention and just say, okay, well now we might have to start, making plans or making concessions, because if it gets up to 1.2, that's kind of like a barometer of how good or how concerned things need
But
to
if
be.
you punch me in the face and you ask me how hard did it hurt on a scale of 1 to 10, and I tell you it hurt like a 10, and then you go punch me in the face with a 2, I'm not going to be like it's the same as a 10. I mean, I'm still getting punched, but you know what I mean? It's like it's not consistent.
No,
for me,
I
which
think
again, and I'm not even saying they're like, did they make it up? Yeah, they made it up. It's a made up number. But that doesn't mean that it doesn't mean something. I'm just more comfortable looking at the numbers that everyone else is looking at, which is the basic stuff, the general education numbers, if you will, which are the positives, the number of tests conducted, the hospitalizations, and the deaths, of course.
Oh, so to speak to the hospitalizations,
Yeah.
they also said and the governor and Dr. Cabrera were also saying that in concert with the CAR score, what they also pay attention to is what the hospitalization level is. If it ever hits 10 sustained, then that too is the point when they start to say, okay, well, we don't want to get overwhelmed, and knowing what we now know, having gone through last year.
Yeah.
So for me, the kind of interesting thing about the CAR score is the rate of change, right? We go from 0.7 to 0.9 in one day. So how much does that actually mean?
Yeah.
Relative, and then we go from 0.9 to 1.1. So for me, the calculus going from from one day's thing to the next, that's what interests me.
Yeah.
But I
No.
get what you're saying. I mean, I know
it's
you're not
just-
crapping on it. It's
No,
just,
no, I'm not. I'm just
yeah.
saying it just doesn't make sense. Like a 0.7 to a 1.1. I mean, what does that even mean? It's a 0.4 jump, but what does it mean? what does it mean? That's all I'm saying. Because we were told a car score of 2 it's okay. Okay, that's all I'm saying. It's like, and we get comments here. Rosemary, I concentrate on hospitalizations. Jerry, I compare the positive to how many tested. Bev Test J Solace comments, I asked Alexa what's the car score today, and she keeps giving me different car automotive scores.
Oh, you're gonna get like you're gonna get like Carfox or something.
Yeah.
You're gonna get your Kelly Blue Book value for There's the Kelly Blue Book value for
a car score.
Yeah, ask Siri that.
Yeah.
Your 1987 Toyota Camry is now worth.
But I mean, it just seems like if the CDC is moving us our risk status, they're elevating it to say that Guam's more riskier. Like, what data are they looking at, and why does the car score not match that? Is what I'm trying to. I know you guys get it anyway. I was just laying in bed last night thinking about how everyone just parrots this car score. Car score this. Oh, the car score went up to this and that. And it's like we're just reciting these numbers that, to me, and I'm not an idiot. I know you guys aren't either. They just doesn't make sense to me. I mean, it just doesn't. I mean, so, and that's why at the end of the day, we got to do our thing out here and wear your mask, watch your distance, and wash your hands, because that's what makes sense, guys. This, like, R0 transmission daily, whatever, freaking honors math. Give it to me simple, right? You go to the doctor, you're like, okay, what's wrong with me? Okay, that's it. Dumb it down. Dumb it way down, guy. How long do I got? All right. So 9:04. Good morning. Let's head into the KUAM News Zoom room, where we have Major Anton Uggan from the Department of Corrections standing by. Good morning, Major.
Hey, unmute.
Unmute. I gave him a headache talking about the car score. Unmute, Major. Unmute. Okay.
Oops, can you... good morning, Major. Can you hear us?
Can you unmute your mic?
Yeah, your mic's muted, sir.
All right, I'm going to take a break, guys. We're coming back with Major Anton Uggan next, right here on the link.
Catch SportsLink on the KUAM News Morning Show.
June makes the best malasadas in Hawaii. A fact not lost on Daryl, whose brother Byron is cooking the onaga he caught at a secret fishing spot with his girlfriend Malia, who used to work for the Shave Ice Guy, whose second cousin Vince drives the school bus ridden by Calais, whose auntie makes the best malasadas in Hawaii. Everything here is connected, and with the new First Hawaiian Bank mobile app, you can stay just as connected to your finances, and it all starts with yes.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
We got your 6
at 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6.
Complicated, not with too much rhyme and sound, it seems. But you seem to love when I sing the troubles do. The troubles do seek to love when I sing the troubles do. The troubles do singing. Why you gotta be so afraid? when you know
Good morning.
feeling will never fade. So you gotta hold me and never let
Good.
me go score.
Good stuff. Jason J.
That you love me, so please me.
Juices.
Me in your mighty grip, squeeze me.
Good morning. The link brought to you by Calvo Enterprises, Jack in the Box, East West Rental, IT&E. Good morning. 908, Major Anton Uggan. I think we got him now. Good morning, Major.
Good morning. Is that better?
That is much better. So I thought I scared you off with all my car score talk.
No, I'm fine.
Are you good at math, though?
Say again?
Are you okay at math?
A little bit.
Okay, I think we probably had the same teacher, Major.
Not my strongest subject.
Right on. We'll just get right into it. So I was chatting with you a little bit last night, and we had obviously on the show there was a couple of interviews we did with you where, and this is going back to November of last year during kind of like when we were really surging hard. The director of DOC had made a policy change where they had determined just out of safety and precaution that they weren't going to be confining nonviolent offenders and that they would only confine violent offenders and I think warrants as well, right? And so we heard GPD was grumbling about it. You confirmed the cops were calling the deputy over the prison. They were mad because they're out there arresting people for a variety of offenses. And then they're just getting released back out into the public, right? And so now we understand that you're working to reverse that policy?
Yes, Chris. The director, we had a management meeting and the director did reach out to GPD and the GPD management sent us a list of various crimes. Again, most of them are first, second degree that those of course are being accepted without question. Third degree, criminal sexual conduct, those are of course without question are being accepted. We're just concerned about the lower level. I mean, again, crime is crime, but we had some being committed for defective taillights. I mean, those are the kinds of things we're worried about. Theft of property. I mean, yes, those are crimes, but in a time when we're trying to make bed space for isolating and quarantining these inmates as they come in, we don't have a lot of bed space. So those are the main ones we were concerned about. Of course, that's a lot of that has slowed down now that the directors had a conversation with GPD management. And, Chris, at no time, I mean, even if it's theft of property, for example, if they have multiple charges, multiple cases, there's always that opportunity for the officer to contact upper management, the warden, and the warden does have that discretion to say, go ahead and confine them based on the circumstances of what is before us. But all in all, even when this thing started, we probably refused about 10 people, right? Since this particular policy. So it's not great numbers. Most of the lower level offense, when they come inside here by magistrate the next day or later that day, 90% of them are going to be released, that night. So, but we are working on revising it. We've got some input again, and we're just putting together a revised memo, just clarifying some things that were left out of the original memo.
Right. Yeah. Major, I mean, I think the craziest case we saw was this case of Anthony Luis P. Camacho, who was charged with just a whole bunch of theft of service, retail theft, confiscated contraband, illegal possession, Schedule 2, fraudulent use of a license plate, 2 counts, theft of a motor vehicle, 2 counts. So this guy, I mean, well, the charges was like this long, so he was booked and released. So, if the policy is changing, I don't want to go over everything that we did go over, Major, but I will ask what changed. Because you still have to social distance and, allow for the bed space. So what prompted the change in this policy? Was it just the public and media and the police, or was it just something that maybe the director is like, oh my God, well, it's April. Well, it's May. Let's change it.
A lot of it, Chris, was just, again, going back and communicating with the Guam Police and management, the Department of Corrections management. Again, in the time when this thing really happened, November 19, DOC was under a very, we had 77 officers out. We had 160 some inmates COVID positive. So when this thing kind of came out, it was based on the situation at the time. Now we're reevaluating it. We don't have any positive COVID right now. We're also working on getting the COVID testing vaccine by next week. We're going to start trying to get the vaccine. And so, it's time to relook at our policies, we're still concerned about it, of course, but, we understand the need to put those that need to be behind bars, at least until they get before a judge that will make the ultimate decision of whether or not to release them or not.
Right on, Major. So incoming, I know last time we talked, which was about a week ago, you guys sent us some photos of the incoming. Is that process still up and running and going smooth?
Yes, sir. I mean, we have it. It's nothing this week because we do it on I believe it's a monthly basis.
Yeah.
For 1 week or so, a month we do this, and I believe we're done already for last month. Probably later this month, in maybe 2 weeks again, there'll be another opportunity for family members to drop off some incoming.
Where are we with the contraband seizures? Anything officer involved?
Nothing with the officers right now. Again, we've had a few contraband attempts thrown over down in Naganya, some again in Manila. We've caught those and we've relinquished it over to the Guam Police for safekeeping. Most of them are caught in common areas or areas where it's not necessarily we cannot necessarily associate it with a particular individual. But if such happens where we find it on someone, of course, we will have them, criminally charged, and let that process, take its course.
Major, we had a comment here. Does DOC have the authority to release individuals confined due to a warrant of arrest?
No, the department cannot release anybody without a court order, an order from a proper jurisdiction that has custody of that individual, whether it's U.S. Marshals or immigration. Once they're confined, the only one that the director can release are those that have completed their sentence, full-time release. So if they've done their sentence, then those are the only prisoners that the director has the authority to release.
Right. And so during
the rest of them are all released again by a judge, Attorney General's office in the issue of an NTA, or another court order or legal document from the U.S. Marshals or immigration, or basically anybody who has custody of that individual.
So, Major, during the time that you had this non-confinement and non-violent offenses policy in place, you were still confining those who had a warrant of arrest, right?
Yes, sir. Yes, sir. Warrants, judge's orders, a commitment order by a judge, even if for 3 days, we still take those people in. Yeah. It's not just GPD that we confine, and we have immigration, U.S. Marshals that still get confined on a regular basis.
Major, something we haven't been or we haven't asked about is parole. So what's the status of parole operations?
Parole is fully operational. Their headquarters is the old Guam Police Department precinct in Naganya.
Mm-hmm.
They're there, and parole is fully operational. They're presenting their case. Parole board is having their monthly hearings, and basically the officers are working on the reports, and they do their home visits and all the regular activities that they do as part of their duties.
So just back to normal, or did they ever, because of just the different P Corps that we were under, was there ever like a halt in operations? Or
there was some modification in the operations, but we never shut down parole. There would, some home visits may have been minimized, and face-to-face contact, more telephone. I think a few Zoom meetings were held with some of the parolees that had internet access and could do it. But again, they're slowly getting back into, full operational. It's never closed. Parole is never closed.
Do you talk to those guys like pretty regularly?
On the parole officers?
Yeah.
Yeah, once in a while we do sit down and talk.
Yeah. So no, I was just wondering because what do they when they go out and they check on these people who are, have completed their sentence but are still in the system or whatever and are involved with the parole. What kind of conversations do they have with those individuals who go from being confined in a prison setting to coming out into a pandemic setting where in a lot of ways they're still restricted on what they can do? Has that been a challenge? Are we seeing, with recidivism and all that, is that an issue?
I mean, it's, Chris, again, some of the parolees, some of the ones who've been out on parole, they continue. Some of them do violate the conditions. And again, they've been locked. Some of them have been locked up for several years. And when they get out, some of them still have issues with following instructions and staying at home and follow their quarantine regulations. But, the officers, again, do speak to them. They say when they go out to visit them at their residence, they don't get too close, but at least to do home visits and see how they're doing. And the officers also have to go out because the same parole officers that supervise them out in the field are the same officers that are preparing the reports for the monthly parole hearings. So they still have to go out also and meet with family members and victims and prepare their parole report for those that are in prison that are wishing to get out on parole. So the officers have their day pretty much filled up, pretty busy. And there's only, I believe, 4 parole officers right now that are out there in the field preparing all these reports and supervising. Right now, I think there are over 250 parolees that are active out there.
Sounds like you need more parole officers.
Oh, yeah, definitely.
And are you guys
Yes,
hiring
sir.
for those positions or?
No, sir. We did hire 2, I believe, last year. Again, everything comes down to, financial, budget issues and concerns. So, but, again, adding the 2 that we did last year really greatly helped out. But again, there's always room for improvement.
What about your shortfall and the American Rescue Plan funds? Are you guys anticipating any money from that $660 million? And if so, what is it going to be used for?
The details, Chris, of that are still being worked out, but the director and the deputy have been attending governor's cabinet meetings, and we did give them a list, of things that we would like to see, or basically a wish list, right? Because everybody was asked to kind of submit something. The final details are still being worked out. I'm not privy to exactly what all those are right now, but yes, DOC is obviously going to be included in something, but to what extent, I'm not sure.
Okay. Anything in closing, Major?
No, sir. No, sir. Again, hopefully by next week we can start vaccinating. At this point, I spoke to our nurse administrator, and we're looking perhaps starting with the Ganya. We did another survey last week. Right now, we have 320 prisoners that are interested in the vaccine, or about 59% of our population. We're hoping that by next week, as we move forward with this, more inmates will change their mind and be willing to take the vaccine. And again, that would help us with trying to resume visitation, okay, down the road once we, get a better assurance that our population can be safe. But right now, we're looking at 59% of our population that want to get vaccinated.
Wow. Well, so you're already at your path to half. You just got to put the shots in the arms. What do they get if they reach the path to half?
No, nothing. They just get the assurance that they feel safer. I cannot give them nothing. I don't really have anything to give them. Other than that,
All right, Major. So vaccinations going to be started DOC. Do you have a firm date on that, or is it just it's in the works?
Well, it's in motion right now, and we're really looking for next week. So we'll know more before the end of the week stuff. And our nurse administrator is working with public health on ironing out the details. And, so I just spoke to her this morning, and so we're still working with public health.
Right on, Major. Thank you.
We're almost there.
Okay. Thank you for your time this morning. Appreciate it.
Thank you.
That's the Major Anton Uggan, Department of Corrections. Guys, we're going to take a break. 9:23. We're back with more, and we're going to take you to Tarzan Falls. Yep. I hope you got your Bahaki shoes on because it's probably going to be muddy. Okay. That's with our friends at Harlem Hikes, and it's coming up next right here on The Link.
Make sure you're connected. The writing's on the wall. 'Cause if your mind's neglected, stumble you might fall, stumble you might fall.
Connection is a human necessity, one we need today more than ever. And with the new First Hawaiian Bank mobile app, you can stay just as connected to your finances. And it all starts with yes.
Uno Go, delivering meals from your favorite restaurants and more, including delivering sodas and adult beverages from the Bottle Shack. Visit uno-go.com or download the app today. Also follow them on Instagram and Facebook. KUAM's multi-platform morning show, The Link, just got a little more delicious with Feed Me Fridays. Chris, Sabrina, Jason, and the rest of the morning crew will take some time each Friday to talk food, taste food, and bring you all the latest and greatest in food from King's Restaurants and Ruby Tuesday Guam, old faves, new hits, and everything on the menu in between. It's Feed Me Fridays on The Link.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
After a year with so many games and events delayed or unplayed, the world is ready for anything and everything in the world of sports. KUAM Communications is ready with more games, more championships, and more specials that are guaranteed to bring out the fan in you. Don't miss a minute of gameplay from NBC on KUAM TV 8 or from CBS on KUAM TV 11. Every month, we'll bring you the action and excitement. Brought to you locally by Michelob Ultra, Superior Light Beer, and Docomo Pacific. Just more great reasons to tune in and turn on so you'll fall in love with TV again with the best from KUAM Communications. The relationship between Guam and Manila, Philippines is undeniable as we share similar cultural traditions, history, and heritage, with generations of Filipinos calling Guam home. KUAM presents a monthly look at the capital city featuring in-depth and engaging interviews on everything from medical tourism to new business and government leaders. Veteran newscaster Nestor Lecanto delivers Beyond Our Borders. This special program is brought to you by the Bank of Guam and KFC.
KUAM Communications and Denny's Guam presents Mamapreneurs, a special multi-platform series throughout the month of May showcasing mothers who are also local entrepreneurs in our community. In commemoration of Mother's Day, during weekdays in May, we'll feature daily profiles of these multitasking mamas and their businesses. Additionally, on KUAM News Primetime every Monday in May, we'll showcase a different enterprising mamapreneur. Check out our online directory of all these businesses as well on KUAM.com. And if you know a mamapreneur we should feature, send us a message on social media or email executiveproducer@KUAM.com. Mamapreneurs is brought to you by Denny's. Guam's Diner is always open.
Born as an innocent child, in the street refused to donate them greens. The father has been gone for a while, never heard of or ever been seen. What would it take to end the hunger of a man's desire to conquer, which leads the people to suffer and live the life in a war, yeah. Why can't we all
Congratulations to the graduating class of 2021, Father Duenas Memorial School.
Including a young Mr. Barnett.
Yep.
Congratulations, Lennon.
Right on. Thanks, Jay.
How did he finish in his class?
He finished. He finished.
All right.
Yeah.
Right on.
It was definitely a challenging year, I think, for a lot of students. Obviously, that's so.
Wait, so has their graduation already happened, or
No, it's happening today.
Oh, today. Okay.
Yes, sir. 9:28.
Fortis in fide.
So yeah, congrats again to all the friars who are doing the walk. And
How much of a proud dad are you? I mean, this is your second child to graduate.
Yeah,
Your
yeah.
first boy.
Right. So my daughter was homeschooled for a lot. So and my boy, he went to Mount Carmel for middle school, went to FD, was definitely some adapting in the freshman year, but then he's just been loving it, made a lot of friends. Struggled a little bit with online, but when they went back to face-to-face, I think a lot of the boys were able to regroup and finish strong. So congratulations, guys. This is it. I know COVID, right? I was talking to him yesterday. I was like, you feel good? And he's like, well, I feel like COVID kind of stole it from us, but here it comes. It is what it is. So 9:29.
I've never seen your son complain about like anything. Even all those years when, he used to come here after school, Chris would make him, Chris would always go out, buy his kids like a big pizza or, King's meals for like everyone and everything like that. Now, okay, kids, make sure of course, Chris being Chris, I want to make sure you guys are well fed. You guys, I'll go get all your drinks, have enough in a Denny, the Tabasco and everything like that. And then when you're done, then everybody do their homework. Lennon never complained about anything. He was always so happy, so agreeable. Really, really good young man.
Yep. Awesome boy.
What are his plans, may I ask, like after high school?
He's going to go to UOG and then figure out grad school after that.
Congratulations.
Yeah.
All right.
I mean, it just happened so fast this senior year, right? I think for a lot of kids, it was like, how did you make plans for college? You right? I mean, and were you able to, because a lot of the posturing and everything begins in junior year, but there's definitely a lot of stuff that happens in senior year. And were they able to approach all these different things that they need to do to prep for college with like the right mindset, right? Obviously not, because we were in a pandemic, we were locked down. I mean, there was just difficulty with adjusting for everybody, guys, public and private, to online learning, right? So this is kind of like it's just a weird year. I mean, not just for kids who are graduating, but just students and everybody. I mean, it's just been weird for everybody. So any kind of like thing that we can just snatch from this damn COVID and celebrate, I think is what we have to do.
Well, may I ask though, as an FD dad, I mean, I've never known a Father Duenas parent to never be, obviously very proud, but also very involved in their kids' like high school experience and everything like that. How has the experience of being apart ironically brought, the class of 2021 closer together?
No. I mean, same thing with any type of like relationship, whether it's personal, professional, or school, peer to peer. There's a certain amount of bonding that just happened, just baseline, because we all went through this together, right? You know what I mean? Yeah, it's like we do feel like, wow, it's one thing we have in common. I mean, those of us who are here, knock on wood, we made it, right? I mean, for the most part, we did, and a lot of people did. 137 people didn't. I mean, thousands upon thousands caught the virus. My son Lennon caught the virus. He was fighting COVID in November, right? So I think just us being here today and having gone through the lockdown, the shutdowns, the close downs, the ups and downs, it's really just brought all of us kind of closer. You know what I mean, Jay?
Yeah.
I mean, we've gotten closer during this pandemic. You used to really annoy me. Now you only kind of annoy me.
Oh, thanks.
No,
Excelsior.
You know what I mean, though? It's like, yeah, just having gone through all this stuff together, it kind of does like bring us closer.
I mean, the four of us in this room, Sabrina's obviously not here right now and everything like that.
Yeah.
But I mean, we just like, I can just glance at Joe, sir. I already know what he's thinking, what shot he's going to do next.
Right.
I can tell when, you're going to say something. Bree and I have been, that way forever now. But yeah. No, but congratulations to your son.
Yeah,
Man. That's an
and
amazing
to all the
achievement.
grads. I mean,
Yeah.
because GDOE, obviously, people are still going to graduate. And, from Southern High to Sanchez to, JFK to GW, home of the Geckos. Congratulations, Ukadu. God, now that I started saying all this, I have to say all the schools.
Guam High.
My boy Channing's doing a promotional from 5th to 6th. He's going to be in middle school. Like, what's happening? Oh, I just got a text from Betty Ann. She was like, dude, Lennon's graduating?
Yeah.
Yeah. But, I do also want to thank, because obviously FD comes with a price, right? And I know you guys are probably thinking like, hey, wow, Chris Boy goes to FD. Well, must be loaded. No, it was nothing like that. I mean, my boy worked very hard and was the very blessed and lucky recipient of assistance throughout his high school tenure at FD. There was an unknown benefactor who provided my son with some very much needed financial assistance throughout
Wow.
throughout. I think it was this, and I don't even know who they are, right? Because they don't want anyone to know. And there was just a third party. They would give this scholarship over to my boy and I believe another young man, and then this third party would go and deposit it over at the school. So my boy worked hard, and he, I mean, it's difficult. High school is difficult, especially private school. And so to just have that assistance, which I know is not available to a lot of people, so I'm just so grateful that I was able to get that. And he is too, and just really that kind of just shows you about our island community is there are people out there like, and I don't even know who they are, who will give to support the kids, whether it's young men at FD or people in the private schools or the public schools. We see it all the time, right? People step up, and we talked about this yesterday with mental health, about filling in those gaps that we have when it comes to raising kids. Because, it takes a village, right? I think there's a lot of us who still believe that. And so you do see people stepping up, whether it's to provide scholarships or to make donations or to mentor or tutor the youth. So, yeah.
And also indicative of our island culture is whether Lennon truly grasps how much of an amazing gift and a show of generosity that was. He's going to pass that down to somebody in,
I mean, hopefully,
guaranteed
right?
in the
Yeah,
future. No,
yeah,
I mean, it's I mean, and it's not you have to like guilt him into it or you have to tell him to something like that. I mean, he's just going to do it. It's, it's endemic in his, it's in our DNA to take care of each
Right,
other. But,
yeah.
Speaking about graduation, though, you know what I found most amazing about last year's graduation when we did stories with all the drive-through stuff, and we even talked about it before. Adriana did most of the stories of covering the graduation stuff, but we kind of had a talk and said, should we kind of handle this like kid gloves because like the graduates might be like a little sensitive. I mean, their parents were almost in a lot of cases beside themselves because they're like, this isn't the graduation I had, and it's not the traditional turn the ring, turn the tassel and everything. The kids, I got to tell you, they were having the time of their lives. They were like, this is unique to us. This is absolutely amazing. So whereas some people might say you don't get to continue the traditions that's been done from generation to generation, they were like, we just made history.
Yeah, we made a new tradition.
Our graduation was on Facebook, for kids.
We are the class of COVID.
Yeah.
I mean, if anything, there's that's something that all these people around the world are going to have in common whenever it comes up in conversation. Hey, what year did you graduate from high school? Oh, dude, class 2020. Dude, COVID. Or class 21. Oh, man, COVID, class COVID.
Yeah, it gives these kids like a grit and a resolve and, like and a focus that is just awe-inspiring.
Right on. 936.
And for your eldest son to be part of that and everything like that, having watched him grow up, just working here at KUM and everything like that. I mean, congratulations to you and your family, bro.
Thanks, Jay.
That's amazing.
Congratulations to all the graduates.
Yes.
Let's move on because this guy here, Rob Cabadoo, in the comments is saying let's move on. So we'll honor his request. Thank you for that, Rob. Appreciate it. So, yeah, we're going to go to Tarzan Falls with our friends at Harlem Hikes right here on, where's that at? There you go. Right here on the link. Facebook Live, KUAM TV. Hold on, it's buffering. All right. There you go. It's Harlem Hikes again right here on the link. Good morning.
This island that we call home is a place filled with vast beauty, if we could take a moment to realize our island's beauty has many faces. From open sandy shores to rocky coastal cliff lines, the deep valleys, to the freshwater caves of the limestone forests, to cascading waterfalls. Our island's beauty is endless, and that's why when we walk in this land, we walk with respect. We walk with a deep love and appreciation because we are blessed to live in such a beautiful place. Join us on this journey. Myla Harlem.
Hafaday Todas, welcome to the finale of our Harlem Hike series. For this episode, our mentors decided to venture into the Badlands of Zotnya to find the Disney movie-inspired Tarzan Falls. The entire area is known as Kanu'un, which means a place of eating, and is a small part of the mighty Elig River, which is one of our island's longest rivers, the other being Pago and Ugum. The area is known by some Chamorros as hunting grounds as well, so perhaps the name is fitting. It's a place that we could find stuff to eat, Umbri. So, get your saris ready, look to the sky, lift your spirit, set it free, and join us on the finale of our Harlem Hike series.
Oddly enough, even though Tarzan Falls is technically located in Zotnya, the most commonly used entrance is located in Cross Island Road, between Santa Rita and Windward Hills. If you're coming from Windward Hills, continue to drive past Our Lady of Peace and keep an eye out on your right for the telephone line with all the shoes hanging out having a good time. If you're coming from Santa Rita, the left side of the road after the residential area is where you want to be looking. The other landmark that distinguishes the trailhead is the access road to the relatively new installment to the area, the wind turbine, which is a pilot project of Guam Power Authority to test the viability of wind power as an alternative energy source. On this particular day, the turbine wasn't on. Maybe it was working from home.
As far as what to wear when you come here, if you want to know, we can show you. Unless you get lucky with a cloudy day, expect to catch some sun on this one. Have a hat on hand or be prepared to be a t-shirt ninja. Wear or bring swim clothes as there will be an opportunity for waterfall activities and some good hiking shoes or tabbies. Hanam is always priority on these hikes. The waterfall may have fresh water, but better to be safe than get melango later.
Right at the beginning of our trail, we encountered our first featured plant of this hike, Stachytopheta jamaicensis, also known as Jamaican vervain. We couldn't find the Chamorro term for it, so if any of you viewers know, feel free to DM us on our IG at @Anafamala. This plant has a number of useful applications. The leaves can be boiled into a tea and can even be chewed and applied to burns or cuts. The feature that it is most commonly known for are the tiny purple flowers that it produces. These flowers are also edible. As you can see, I'm eating here and it tastes like mushrooms. Look out for them next time and give them a try if you're ever hungry or need a snack while you're hiking. You will immediately notice the presence of ferns here as well. These are most likely Dahlia solida or Puga Matsina in Chamorro. I know we all typically think of these things as decorations, whether it be at a fiesta or in your grandma's backyard, but their leaves and rootstocks have been used as medicine by other islands like Fiji, Samoa, New Caledonia, and Tahiti to treat a variety of ailments like sore throat, asthma, and arthritis. Ask your local Suruhano or Suruhano for more information. Support local, name.
The beginning of the trail is level for the most part, partially due to the amount of traffic the area receives. The way is well marked by hiking tags nowadays, so keep your eyes out for them and keep on strolling. You will eventually be led behind the fence where the wind turbine is located. Continue to follow the trail that leads left, as the paths that lead to the right are most likely heading to Tarzan Falls. Though another great spot, our path today is set for another, maybe next season. Another thing you will definitely notice here is the relief from Isemnak from very large trees. Most of the trees here were planted as part of the coastal conservation area and are meant to help preserve and rejuvenate the soil in these badland areas. These trees planted here, Acacia auriculaformis, are a variety of acacia trees that are fire resistant, help replenish nitrogen in soil, and are great for assisting in the prevention of wildfires. Though they are not native to Guam, they help turn these areas from badlands into good lands. The wildfires in this area are almost always, if not always, caused by humans. Whether it's from a stray ember from a burn pile or an intentional fire set by lazy hunters, the wildfires do tremendous damage to the plant life that undo the effects of erosion in the area.
As the way begins to incline, you'll be treated to a spectacular view of the area between here and the Leo Palace Resort. This is a perfect vantage point to see the large-scale effects of soil erosion. A significant amount of erosion is due to the prominence of recreational off-roading here, especially from those who decide to deviate from well-established trails and create new ones. Now, before all of you off-roaders start calling us buzzkills or whatever, just know that we're not here to tell you what to do. How you choose to spend your time is up to you, but what we do want is to educate people on how these activities affect our island and in turn us as well. The sedimentation from here eventually ends up in the ocean and onto the reefs, which further damage an already stressed ecosystem. Crazy to think about, I know, considering how seemingly far away the ocean is from this place. But it goes to show the duality of our human potential for destruction and creation. Okay, stepping off the soapbox now. Back to the regular scheduled program.
On a lighter note, another thing that becomes apparent is the presence of clay. Normally, access to this resource requires you to dig, but around here, the vehicles do the digging. Clay was a very important resource to the ancient Chamorros, as they used it to make all kinds of things. One would only have to look at all the collected pottery shards to see just how much our ancestors utilized this material. From fire pits to intricately designed pots embedded with afuk, the versatility is only limited to the imagination of its user. Also, if you forgot to bring sunblock, you could use the wet clay to cover your skin. The clay will keep you cool and it offers a bit of protection from sunburns.
The descent to the falls will be pretty straightforward if you follow the trails that have already been made and the hiking tags. There will be a point where you reach a small rest stop where you can chill out, gather yourself for the rest of the way. This is also a good indicator that you're on the right path. Just keep on keeping on down the steep hills, being mindful of your steps of course, and you'll be there before you know it. You'll definitely hear the falls before you see them, so make sure you Q-tip good and clean those ears.
Arriving at the falls rewards you a spectacular view from the top of the falls itself. You will see the river and a couple of mini waterfalls. You can use them to cool yourself off or get zen if that's what you're into. Just be super careful and social distance yourself from the edges of the rocks. There is a small cave-like crevice that you can also use as a pretty comfy place to get away from the sun, and a path to the bottom of the falls on the opposite side of the river that you entered from. The water at the bottom is just deep enough for you to catch a quick dip to, and if you decide to follow the river downstream, eventually you will be led to the Tarzan pools, but we'll save that for another time.
Though we haven't heard of any artifacts being found here in particular, we imagine with the amount of fresh water and resources that the river provides, our ancestors utilized the place just like other waterfalls that can be found around these parts. Tarzan, Sigua, and others like them our oasis in an otherwise barren landscape, and serves not only as a place to have fun at, but as a tangible reminder of the power of human intervention. With the popularity of this place growing more and more, it is important that we understand the significance of what this place and places like it can teach us about just how connected our island is to itself, to us, and what we can do to strengthen that connection.
Our island is our inheritance. It holds pieces of our past and symbols of our strength. It holds the causes of our joy. It's a place where we come together. It is a place of healing. Our island is our refuge. Our island is a place of peace and tranquility. If we would just take a moment to find it. Sidus Ma'asi, Tadas Hamdu, Saina Ma'asi, Tansiduus, from Benin, DC.
No need to react, this moment soon will pass. Stay humble and be dignified, everything is good inside, like it not diminished. When we stay committed to knowing what we've omitted illuminates the vision. Precision of thought is awareness of the self, not selfish, discerning what truly cannot be helped. A rock that wants to melt does not stay above the surface, but communicates to relatives and asks them for the service. Searching for the fire, or beings that perspire. Transcendence is creators' plan that works beyond desire. A higher
KUAM's multi-platform morning show, The Link, just got a little more delicious with Feed Me Fridays. Chris, Sabrina, Jason, and the rest of the morning crew will take some time each Friday to talk food, taste food, and bring you all the latest and greatest in food from King's Restaurants and Ruby Tuesday Guam, old faves, new hits, and everything on the menu in between. It's Feed Me Fridays on The Link.
Family platter of fried chicken?
Check.
Tray of red rice?
Check.
Birthday cake?
Check.
1 case of water?
Check.
12-pack of beer?
Check.
2 cases of Pepsi?
Check. When you have a long checklist but are short on time, we got you. Get it delivered by us. Order on the app or website at uno-go.com. Guam On Demand.
Shoot, I forgot the paper product.
Oh wait, UnoGo has that too.
June makes the best malasadas in Hawaii, a fact not lost on Daryl, whose brother Byron is cooking the onaga he caught at his secret fishing spot with his girlfriend Malia, who used to work for the Shave Ice Guy, whose second cousin Vince drives the school bus ridden by Calais, whose auntie makes the best malasadas in Hawaii. Everything here is connected, and with the new First Hawaiian Bank mobile app, you can stay just as connected to your finances, and it all starts with yes.
Get the job done the right way by getting the right stuff at East West Rental Center. With years of experience helping builders, we definitely got what you need. Call 646-1463 or visit us in Upper Tumon. Open Monday to Saturday from 7 a.m. to 5 p.m. and on Sundays from 8 a.m. to 5 p.m.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
The relationship between Guam and Manila, Philippines is undeniable as we share similar cultural traditions, history, and heritage, with generations of Filipinos calling Guam home. KUAM presents a monthly look at the capital city featuring in-depth and engaging interviews on everything from medical tourism to new business and government leaders. Veteran newscaster Nestor Lecanto delivers Beyond Our Borders. This special program is brought to you by the Bank of Guam and KFC.
KUAM Communications and Denny's Guam presents Mamapreneurs, a special multi-platform series throughout the month of May showcasing mothers who are also local entrepreneurs in our community. In commemoration of Mother's Day, during weekdays in May, we'll feature daily profiles of these multitasking mamas and their businesses. Additionally, on KUAM News Primetime every Monday in May, we'll showcase a different enterprising mamapreneur. Check out our online directory of all these businesses as well on KUAM.com. And if you know a mamapreneur we should feature, send us a message on social media or email executiveproducer@kuam.com. Mamapreneurs is brought to you by Denny's. Guam's Diner is always open.
Catch SportsLink on the KUAM News Morning Show, The Link, every Friday to hear about the latest in sports news, game schedules, athlete profiles, and more. SportsLink, brought to you each week by Cure Alkaline Water, airs every Friday across the multimedia platforms of KUAM. Tune into the broadcast on Breeze 93.9 FM on KUAM TV 11, live streaming through the KUAM News Facebook page, or view highlights on YouTube, KUAM News Facebook, and Instagram. SportsLink is hosted by Dave Delgado through KUAM Sports, and he will make sure that everyone knows what is happening on the fields, in the gyms, and everywhere in between.
After a year with so many games and events delayed or unplayed, the world is ready for anything and everything in the world of sports. KUAM Communications is ready with more games, more championships, and more specials that are guaranteed to bring out the fan in you. Don't miss a minute of gameplay from NBC on KUAM TV 8 or from CBS on KUAM TV 11. Every month, we'll bring you the action and excitement. Brought to you locally by Michelob Ultra, Superior Light Beer, and Docomo Pacific. Just more great reasons to tune in and turn on so you'll fall in love with TV again with the best from KUAM Communications.
Demon Slayer, Mugen Train. All right, this is hot. You know about Demon Slayer?
I think I've seen the trailer on YouTube.
Yeah.
I watch so much YouTube. I'm trying to think. Demon Slayer.
It's anime.
Oh, okay. Yeah. Oh, that looked good.
So I have a couple tickets here to give away from our friends at Tango Theaters. We'll take caller number 1 at 637-0094. That's the number to the link here. Again, caller number 1. Come on in, and we'll hook you up with 2 tickets to go see Demon Slayer, Mugen Train on the big screen.
I know for a fact I've never seen anime in the theater.
Right.
Anime is cool. Man.
That's what's cool about it, is you're going to get to go see it in the theater.
Remember
like
Akira?
My cousin says, dude, I downloaded that a couple weeks ago.
A couple weeks ago?
I read Akira the comic. I owned it.
I never understood it. When I worked at Blockbuster in 92, like we got it and everybody kept talking about how good it was, and then we watched it and I was like, wow, this is really like blowing me away. I have no idea what's going on.
There's something with a whale.
Yeah, and then a little kid that's like divine or something like that, and then a dude's like on a motorcycle.
Mm-hmm. Yeah, I got to watch it again because I forgot. 9:55. So, yeah, we'll take the first caller, 637-0094. Hook you up with a couple movie tickets from Tango Theaters. In the meantime, brought to you by Burger King and Docomo. Our friend CJ with Cover Me this morning. It's called, you got that, sir? Or wait, you got Joe, sir. We'll go Joe Cruz. It's his birthday.
Yeah, it's Joe's birthday today.
Right.
From Santa Rita, you guys may know him. He used to work at Capricciosa down at the Agana Shopping Center.
Right,
Real nice guy.
Yeah.
He gigged here, like played with all sorts of musicians, and then a couple of years ago moved to San Jose, where he is doing really well for himself.
Right on. And again, we'll take the first caller, 637-0094. Win you 2 tickets to Tango Theaters. Cover Me again, Docomo Pacific and Burger King.
A certain shade of green. Tell me, is it what you need? All signs around, they say move ahead. Won't someone please explain to me your ever-present lack of speed? Are your muscles bound by a ropes? Or do crutches cloud your day? My sources say the road is clear, and street signs point the way. You're gonna stand around till 2012 AD. What are you waiting for? A certain shade of green. Think of Google Gray, watching you procrastinate. What are you waiting for? A certain shade of what, a written invitation. Sign truth now or lose it all. Sedate your hesitation, or inflame and make you stall. You've been raised in limitation but that glove never fit quite right. The time has come for hand-me-downs. Choose a new, please evolve and take flight. You're gonna stand around till 2012 AD. What are you waiting for? Racer, teen, shade of green. Think of Google Gray, watching you procrastinate. What are you waiting for? Racer, teen, shade of gray.
Up there, Joe Cruz. Happy birthday, Joe. Cover me.
13 shade of gray.
All right, 9:58. Just really quick, got to get a winner here. Giving away 2 tickets to go see Demon Slayer Mugen Train, but only if you're like anime woke. Justin, hello?
Hello?
Congratulations, my friend. You're a winner.
All right, thank you.
Dude, are you into Demon Slayer?
Oh, yeah.
Oh, wow. Right. My boys just got into Naruto, so I asked my son Channing last night, hey, what's Demon Slayer? And it was like a pretty long explanation. So it sounds like you're in for a cool treat. It's going to be cool to watch it on the big screen at Tango Theaters, my friend.
All right.
Congratulations. Stand by, all right?
All right, thanks.
Okay, hold on. There you go. Congrats, Justin. Thank you, Tango Theaters. Jason, great job. Joe, sir, great job. We got your 6 with our primetime newscast for the KUAM News team. KUAM TV. It's been awesome. My name is Chris. Hasta. Adios!